Good evening everyone. Hope I'm audible. Yes, good evening. How are you all? Please tell me if my audio, video, everything is clear or not. I want to make sure the connection is good. Okay, so connection is good, right? Just let me check by myself. Yes. Good evening. कैसे हो? So we are very closer to exam. All clear. Very happy to hear. So many of you people were asking me, hello. तो मुझे बहुत लोग पूछ रहे थे. Many of you were asking me, sir, will you take classes for us through AFMG? Yes, here I am. So I'll be taking you a quick revision session of pharma, right? So चलिए शुरू करते हैं. शुरू करने से पहले लेट मी टॉक टू यू पीपल सम टाइम, मतलब 1-2 मिनट बात कर लेते हैं. आई एम प्रीटी श्योर यू पीपल हैव सो मेनी क्वेश्चंस राइट नाउ, सो लेट मी आंसर दोस फर्स्ट. बहुत सारे क्वेश्चंस होंगे आप लोगों को. आई वांट टू आंसर दोस. चलो बताओ. सो सर, इस टाइम पे क्या करना चाहिए, क्या नहीं करना चाहिए? दैट्स योर फर्स्ट क्वेश्चन. अपार्ट फ्रॉम दैट, सर डरेंगे, मतलब डर बहुत आता है, कैसा मेंटेन करें? दैट इज योर सेकेंड क्वेश्चन. आई विल आंसर दैट आल्सो. और कुछ? जल्दी बताओ. सर याद कैसे रखे, वो भी एक क्वेश्चन. दैट आल्सो आई विल आंसर. और कुछ है तो बता दो. लेट मी आंसर एवरीथिंग. So listen up guys, listen up. Hello everybody. So listen carefully. Now I'm going to talk to you people about some serious issue which every one of you have been facing. Sir, we are having very short time. What we should do and what we should not do. What you should do, क्या करना चाहिए? I'll tell you people. The thing you need to do is always remember the content whatever you have been studying so far. That content I want you to repeat. ऐसा नो, बिल्कुल आज के बाद फार्मा भूलनी नहीं चाहिए. वो करने के लिए मैं बैठा हूं. ठीक है? यस, अनोटेटेड पीडीएफ आई विल शेयर इट. ठीक है? नाउ लिसन. तो पहली चीज, व्हाट आई वांट यू पीपल टू डू, मेनी पीपल वुड हैव टोल्ड यू दिस, बट despite of telling this much, you people end up doing the same types of mistakes. So I want you to listen to me carefully. Do not change any of the notes now. Right now बहुत ज्ञान देने के लिए इधर उधर से आ जाते हैं. ये 4 पेज पढ़ लो, तुम्हारा हो जाएगा. तो भैया मतलब जो बोल रहे उसका क्यों नहीं हुआ, राइट? सो दैट इज very fundamental question I have, which nobody can answer, which everybody fails to answer. So please understand this fundamental question. That fundamental question is thank you. So that fundamental question, never ever change your material. And second thing, now many people will come and tell you that is one important thing. Yes, sure, both we will do, no worries. Now listen to me. The fundamental thing what many people tend to do is that they tend to revise everything. Do not revise everything, only important points. Sir, how do we know these important points which you are already highlighted? आप लोगों ने पहले highlight कर दिए होंगे. You would have highlighted earlier. So I want you to do the same thing now, that focusing upon your highlights alone. Focusing upon your what? Highlights alone. So always understand the highlights. And the faculty which spend so much time and the team which spend so much time on you people, without listening to them, you people end up listening to some bad advisors. Do not do that. The next thing is that the most important thing right now what you require is sufficient sleep. Get your sleep 6 to 7 hours right now. 6 to 7 hours का sleep important है, very important thing. Without your 6 to 7 hours of sleep, the complete 24 hours of study will become waste. So I want you people to understand, you need to, yes, good evening Shekhar Tiwari. So I want you to understand this one important aspect. Sleep is a very important, crucial thing. Another one is that many of you are sitting in the Gautam Nagar. So for you people, the next important advice I'll give is maintain this as well. Food and the sleep, these two are very important things. This is your first thing. How not to forget? Right now, don't pressurize your brain to remember. Just I want this to be remembered, I want that to be remembered. Don't try to do that. Do not stress your brain. Just open the notes और देखते जाइए. That is how you need to do. About the last 7 days, I will talk in the last of the class. सब कुछ अभी बता देंगे, फिर मन नहीं लगेगा ना, है ना? तो साथ साथ everything will have to manage. Yes, last 7 days I'll tell you, last one day I'll tell you. So I'll tell you completely, I'll give you a plan at the end, the last 7 days में क्या करना चाहिए, क्या नहीं करना चाहिए, and I will tell you what you need to do and what you need not to do on the day of exam as well. So all of these things I will cover it up today's session. But before going there, let's start with the pharmacology. So when we want to understand pharmacology, guys, आप लोगों ने बहुत pharmacology you have studied so far by now. So but if you have studied pharmacology, still you people will have some important aspects. So right now let's start with that important aspect. So when I'm telling you people, so this is a very short session, 2 घंटे में हम लोग pharma, in 2 hours we are going to learn pharma. So if we are learning pharma, I want you people to understand one of the most important pharmacology which is hated by every MBBS student, every foreign medical graduate, everybody, that is your autonomic nervous system. Most of us hate autonomic nervous system. So autonomic nervous system, we have sympathetic nervous system, all of us know that, and one more system, that is your parasympathetic. Yes sir, ये सारे तो हमें पता है, और कुछ बताओ. I'll tell you people what you need to remember, what you need not to remember. So understand sympathetic and parasympathetic nervous system. So sympathetic, what it does, parasympathetic, what it does. I'll quickly give you an idea. Sympathetic on the eye, it will cause dilation of the pupil, that is only called as mydriasis. Now it is going to be little faster. I want you people to understand. Yes. I will cover up everything. Now listen to me. Mydriasis. Now mydriasis, opposite in the parasympathetic, there will be meiosis. All of us know this. Why we need to know these two are important aspects. When I'm teaching you people about atropine, etc., it will become an important concept. Mydriasis, apart from the eye. So there will be decrease of the secretion. With what? With the autonomic nervous system, that is sympathetic activation. Good evening. And parasympathetic activation will lead to increase of the secretion. Guys, I have only one request I can tell you people right now. जितने भी लोग हैं सबको शेयर करो तुम्हारे FMG दोस्तों को. Let them get benefit of this session. Let them not lose it out. So decreased secretion and increased secretion is done by sympathetic and parasympathetic respectively. Okay, and I want you to understand sympathetic will lead to increase of heart rate. Yes, of course there will be increase of BP. Yes, agreed. There will be increase of force of contraction of the heart. Agreed. There will be increase of the O2 demand of the heart. All this will become important concepts. I want you to understand exactly opposite. Everything will be decreased in the parasympathetic activation. So sympathetic is controlling major stimulatory activity upon the heart. Major stimulatory activity upon the heart is controlled by sympathetic nervous system. Clear? Everybody सबको फॉलो करने हो पा रहा है कि स्पीड ज्यादा हो रहा है? प्लीज क्विकली फटाफट से कमेंट में आंसर बताओ, so that I can continue. Now let's look here. The next important one, I want you to understand GAT. GAT के अंदर very important aspect, GAT में क्या क्या होता है? So in the GAT there is something called as a secretion. There will be decrease of the secretion. Agreed. Of course we have one simple principle, we applied it already. So decrease of the secretion, and there will be decrease of the motility. I'm sorry, there will be decrease of the motility. That means peristalsis will be decreased. Peristalsis क्या हो जाएगा? कम हो जाएगा. Apart from that, all the sphincters are closed. What is that? All the sphincters are closed. And exactly opposite, that is your parasympathetic. There will be increase of the secretion. There will be increase of the motility. All the sphincters are open. Very simple logic. Many of you people require this technique right now. So whenever you are resting and digesting, so I have one advice to tell you people right now. Do not write the notes. Just listen to what I say. We'll give you the annotated PDF. Is that okay? Just listen. तुम्हारा पूरा 100% attention towards what I'm telling and what I'm writing. Now listen. Whenever eating the food, all the sphincters has to be open so that whatever food you swallow, which will go into the GAT. जो भी food आप swallow करेंगे, वो अंदर GAT के अंदर पास होने के लिए sphincters क्या होना चाहिए? खुल जाना चाहिए. That is what is required with the parasympathetic activity. इसलिए आपने उसको बोले थे rest and digest. Flight or fight response. During that time, you need more of your vision and more of the blood supply and more of the oxygen. So because you are in a fear response or you are in a type of fighting response, that time sympathetic is active. Hope everybody is clear so far. Now let's continue to the next important aspect, that is your bladder. I'm not going to discuss right now. I'm going to discuss it in the further part of the lecture, क्योंकि that will make us the IANS will become simplified, physio भी simplify हो जाएगा, at the same time other things also will become easy. Everybody able to follow? I want one thing in my class, that is silence or the response. I require response. Now I require that same response. Good evening Narendra. So I require the same response from the comments also. थोड़ा बहुत तो comment कर लो, ठीक है? Now listen to me very carefully. So let's understand one important aspect, that is called as your Cholinomimetics. What is that? Cholinomimetics. क्या होते हैं? Cholinomimetics. So those of you who hated pharmacology, who didn't understand pharmacology, for you people, I will give you a simplified version. Cholinomimetics are any group of drugs which increase the parasympathetic activity. बात खत्म. They increase the parasympathetic activity. Very nice to see everyone. Parasympathetic activity will be increased with the help of cholinomimetics. That is the rule. So whenever you use a cholinomimetic, you are getting which effect? All the parasympathetic effect. Parasympathetic effect. Now, when we are talking about increased parasympathetic activity, cholinomimetics will have two mechanisms of actions. One of the mechanism of action is that they will inhibit acetylcholinesterase. Acetylcholinesterase को क्या करेगा? Inhibit करेगा. Because of that, there will be increase of the acetylcholine. So that will lead to increase of the parasympathetic activity. Now listen to this very carefully. So why parasympathetic activity is increased? Because parasympathetic nervous system predominantly operated by which neurotransmitter? That is your acetylcholine. इसलिए parasympathetic activity will be increased. So the parasympathetic activity will be increased as a result of what? Result of increase of the acetylcholine. So this is one drugs. All of you remember, this is a confusing point. That is, these are only called as anticholinesterase drugs. Anticholinesterase drugs. So why am I telling you people anti मतलब against an enzyme called as acetylcholinesterase? That is why we are going to call them as anticholinesterase drugs. So these drugs include drugs such as we have something called as neostigmine. Now we have one more drug, that is physostigmine. That is your physostigmine. Now, physostigmine के अलावा, apart from that, we have other drugs such as galantamine. Apart from galantamine, we have drugs such as rivastigmine. We have one more drug called as rivastigmine. Okay, sir, why have you written them separately? I'll tell you people. I want you people to understand some concepts here. So, rivastigmine, we have one more drug, that is your donepezil. So all these drugs, among these, this donepezil will become a very important MCQ. So wherever I'm telling you people an MCQ, that should be highlighted. And neostigmine ke alawa, we have one more drug. What else is there apart from the neostigmine? Or a drug that is your pyridostigmine. What is that? Pyridostigmine. Sir, where do we use all these drugs? What and all we need to remember? Simple as that, my dear students. These two drugs, yes, of course it will be available. Neostigmine and pyridostigmine, these are the two drugs which will not cross the blood-brain barrier. If they are not crossing the blood-brain barrier, their activity will be in the periphery. Is it going to brain? No, it is only in the periphery. So peripheral action will be there. That is why pyridostigmine will become the drug of choice for something called as myasthenia gravis. What is that? Myasthenia gravis. So simple one, I want you people to remember. We have pyridostigmine, that will be drug of choice for myasthenia gravis. Okay, in myasthenia gravis, if they don't give you option as pyridostigmine, yes, we can give which anticholinesterase drug, that is your neostigmine. Everybody following? Okay, myasthenia gravis drug of choice is yes, that is your pyridostigmine. We can use neostigmine, but long-acting drug is this is your pyridostigmine. So better use pyridostigmine. Okay. Apart from that, we have physostigmine here, my dear students. Physostigmine will cross the blood-brain barrier. Since it is crossing the blood-brain barrier, so now think about this. There is some poison, some drug, something. They're there. Now these are crossing the blood-brain barrier. And the antidote was physostigmine. So physostigmine will also cross the blood-brain barrier. That is why we are using this drug. Even better idea, we have atropine. Atropine will cross the blood-brain barrier and block the cholinesterase. To reverse that effect, we are going to use physostigmine. So it will become antidote. It will become antidote for two overdoses. That is your one of the most important thing. All of you know what is that? Atropine. Antidote for atropine. Apart from the atropine, we are this. These are also used for belladonna. What is that? Belladonna. In the which condition? Belladonna alkaloids. And I want you to understand this one of the most important aspect. Then we have one more thing, that is your datura. What is that? Datura. My dear students, listen to me. This datura will become a very more important aspect. Why? Datura has some alkaloids like atropine. Some alkaloids like atropine. Okay. Now, why donepezil is written? Donepezil is one of the most important drug. It is drug of choice for some disease. What is that? Alzheimer disease. So Alzheimer disease. So I want you people to understand. Now listen to me very carefully. A 75-year-old male came to the hospital, was brought to the hospital by his son with the complaints of confusion, and he was found to have dementia. This dementia was progressive. He was suspected of a senile disease. मतलब एज एसोसिएटेड डिसीज होता है, that is your Alzheimer. So एज एसोसिएटेड डिसीज के लिए एज एसोसिएटेड डिसीज, that is your Alzheimer disease. Age associated disease is a Alzheimer disease. So in Alzheimer disease, we are going to use the drug that is your donepezil. Clear? Right now it is clear. Voice breaking clear? Okay. As I can check here, voice breaking is not there. अगर किसी को आ रहा है तो एक बार वीडियो क्लोज करके. So these are the most important aspect. We have one more anticholinesterase drug. That anticholinesterase drug is that is used for something called as tensilon test. We have a drug called as edroponium. What is that? Edroponium. Now edroponium is a short acting drug. Even I can say shortest acting drug, because of which we are going to use it in a tensilon test. So tensilon test कहाँ पे किया जाता है? It is done again in the myasthenia gravis. Right now it is breaking. I think it's not breaking. No, I don't think so. It's not breaking now. Hope I'm clear. Please respond. Okay. Now listen to me. When I'm talking about tensilon test, if you do a tensilon test, there are only two outcomes. One of them will be your positive. Tensilon test is negative. How to remember? If symptoms improve, that is tensilon test positive. If symptoms improve, tensilon test positive. If symptoms do not improve, then it is negative. Tensilon test positive. If tensilon test is positive, that means the diagnosis is myasthenia gravis. Okay. Now, next important, if it is negative, this is like to be cholinergic crisis. And there are some places where tensilon test can be considered, but it won't be of any great use. But this is a disorder associated with presynaptic calcium channel destroyed, presynaptic calcium channel destruction. Okay, so but I wanted to remember these two. Tensilon positive, myasthenia gravis; negative, cholinergic crisis. If positive, what will be your drug of choice? Here it is written. That is your pyridostigmine. Okay, once we understood about these things, let's go to the next group of drugs. They are called as direct acting. What is that? Direct acting. Direct acting are nothing but they are your directly cholinergic agonist. Means they will stimulate the cholinereceptor. So they are working like a acetylcholine, such as carbachol. We have a drug called as carbachol. Okay, we have one more drugs that is called as betanacol. Bethanacol. Apart from the bethanacol, we have one more drug that is only called as methacholine. That is only called as methacholine. We have one more drug that is your pilocarpine. What is that? Pilocarpine. Okay. When you are looking at this, this bethanacol is such a drug which is used as a drug of choice for post-operative urinary retention and post-operative. What is that? Post-operative ileus. What is that? Post-operative ileus, which sometimes called as post-operative intestinal obstruction भी बुलाया जाता है. But post-operative urinary retention and ileus meat is used. Why? Because this is a cholinomimetic which has shown more affinity towards urinary bladder and the GIT. इसीलिए ठीक है. Methacholine there is least likely, but they can ask you a question sometimes. That question which can be asked sometimes, where this methacholine challenge test is used, it is used in something called as methacholine, M for methacholine challenge test. This methacholine challenge test is done for bronchial asthma. Thank you Mahipal. Bronchial asthma में use होता है, that is your what is that? Methacholine. So when we are talking about pilocarpine, yes, pilocarpine is used in glaucoma, but आज के time पे we have better drugs. Okay, and one important aspect, very good everybody. Okay, very good. Mohit Singh, Durga Devi, both of you are correct. Now listen to me. Pilocarpine can cause one of the dangerous side effect. That is, it can lead to retinal detachment. Okay. Now I want you to understand other uses, such as one of them is there Sjogren's syndrome. So Sjogren's syndrome will present with what? Sjogren's syndrome will present with dry mouth, dry eye, dry vagina. So that is xerostomia, xerophthalmia, and dry vagina. Can anybody tell me what is the consequence of dry eye? So remember, consequence of dry eye. In the Sjogren's syndrome will lead to keratoconjunctivitis sicca. What is that? Keratoconjunctivitis sicca. So this Sjogren's syndrome, आज की time पे drug of choice is cevimeline. What is that? Cevimeline. Okay, very good. Xerophthalmia, xerostomia, very good. Drug of choice is cevimeline. Sjogren's syndrome में दो antibody दिखते हैं. What are those two antibodies? Antibodies seen here. Antibodies. These are anti-Rho and anti-Law antibodies. Very good. Let's continue. So when we are talking about this is cevimeline and these are the drugs we have. So apart from that, there are other uses to these drugs. पुराने टाइम्स में टैकिकार्डिया में भी यूज करते थे. इन ओल्डर टाइम्स, yes, tachycardia they were used. And in the eye, lubricant is used. What is the name of that lubricant? That is your methyl cellulose, which is commonly used lubricant. But I want you to understand one thing. This commonly used lubricant, they are not going to ask you. Rather, they are going to focus on the cholinergic drug, which is used in the condition that is Sjogren's syndrome. Let's continue. Hope everybody is clear so far. चलिए आगे बढ़ते हैं. Apart from this, so we are done with the cholinergic drugs. I'll give you summary for 2 minutes. Listen. Antidote for atropine and datura, physostigmine. Blood-brain barrier not crossed by neostigmine, pyridostigmine. Drug of choice for myasthenia gravis. Very good. Then we have next thing, Sjogren's drug of choice is cevimeline, and next thing we have, what is that? That is your methacholine challenge test is used in bronchial asthma. आज के टाइम पे करते नहीं है. Post operative urinary retention and ileus. What is the drug of choice? Bethanacol. This much if you remember, most of the questions related to this topic will be done. आज मैंने एक challenge लिया हूँ खुद से. Personally, I have taken this challenge. Let me see if that challenge will be successful or not. That we will know on the day of exam. That the challenge is that at least 10 to 12 MCQ points should be covered in this 2 to 2.5 hour session. What we are going to do इन 2 to 2.5 hour सेशन कितने क्वेश्चन कवर अप होनी चाहिए? 10 to 12 MCQs should be covered. 10 to 12 MCQs should be covered. That's what we are trying to understand. Let's get into the next important aspect. What is that next important aspect? That is your cholinoblocker. What is that? Cholinoblockers. Cholinoblockers, always there are questions. Always there are questions. So I want you people to understand and answer these cholinoblockers very clearly. So cholinoblockers, they are going to block your, what is that? They are going to block your cholinereceptor. They are going to block your cholinereceptors. Okay, if they are blocking the cholinereceptor, if they are blocking the cholinereceptor, means what is going to happen? They are to lead to one simple basic, that is they will block the parasympathetic activity. They will block the parasympathetic activity. Very good. When we are talking about cholinereceptor, I'm not going to go into that classification. जैसा बच्चे जैसा करते हैं ना, मतलब जब शुरुआत में करते हैं ना हम लोग M1 M2 M3, फिर से वही बोलूंगा M1 M2 M3, फिर से वही रहेगा, फिर तुम्हें भी फायदा नहीं होगा एंड मैं मतलब तुम्हारा भी टाइम वेस्ट हो जाएगा. आई वांट टू प्रिवेंट दैट फ्रॉम हैपनिंग. तो लेट्स गेट इनटू द डायरेक्टली इनटू द ऑर्गन. ऑर्गन में कौन से रिसेप्टर है और उसका यूज क्या है, फटाफट ऐसे ही करते हैं ताकि यूज हो जाएगा. बहुत जल्दी करते हैं. लिसन, लेट्स स्टार्ट विथ आई. आई के अंदर कौन सी कोलिनो रिसेप्टर्स? इन द आई व्हिच रिसेप्टर्स आर देयर? M3 cholinereceptors are there. M3 cholinereceptors. In the eye, if you stimulate M3 cholinereceptor, that will lead to mydriasis. It will lead to, if you stimulate the receptor, they will lead to meiosis. Sorry, it will lead to meiosis. Okay, if I block the receptor, they will cause mydriasis. Mydriasis is nothing but what? Mydriasis is nothing but pupil dilated. So mydriasis condition can be used in the fundoscopy. Fundoscopy is nothing but, आप ये मत बोलना सर हम लोग यूट्रस का फंडस देखेंगे, है ना. Please don't tell me यूट्रस का फंडस देखेंगे. Fundoscopy can be done in eye as well. So fundoscopy is nothing but looking at the eye, fundus of the eye, and we are also using the examination of the retina. retina को retinoscopy, retina check करते हुए use करते हो. In this condition we are going to use cholinoblockers such as atropine. Okay, we have drugs such as homatropine. Okay, we have drugs such as we have cyclopentolate. Okay, apart from cyclopentolate, we have, what is that? That is your tropicamide. What is that? Tropicamide. Okay, so these are the drugs we have. Okay, among these, all of you tell me what is the shortest acting drug? The shortest acting drug will be your tropicamide. So shortest acting drug will be used in adult. अडल्ट के अंदर कौन सी यूज किया जाता है? दैट इज योर ट्रॉपिकामाइड. इन द चिल्ड्रन दिस विल बी द ड्रग. So what is this drug in the children? Why we are using atropine? Because the ciliary muscles are located where? अब प्लीज ciliary muscle पूछूंगा तो फ्लो में गलती से भी ये मत बोलना कहीं और है, सच बाइसेप्स के बगल में है ना, ग्लूटियस मैक्सिमस के पीछे है, ऐसा मत, ठीक है. सो वेयर दे आर लोकेटेड इन द आई. सो ciliary muscles in the eye of the children, they are strong. तो स्ट्रांग होने की वजह से एट्रोपिन इज वेरी स्ट्रांग एक्टिंग एजेंट, इसलिए यूज किया जाता है. ठीक है, चलो लेट्स कंटिन्यू. आई के बाद सर एट्रोपिन का दूसरे यूजेस, जल्दबाजी नहीं करते हैं, लड़ो मत, आगे चलते चलते तुम्हें समझ में आ ही जाएगा. ठीक है, चलो और एक जगह देख लेते हैं. सीएनएस के अंदर वी हैव ए ड्रग कॉल्ड एज स्कोपोलामाइन. सर मुझे ना बहुत टाइम से एक क्वेश्चन है, व्हाट कोलिनोब्लॉकर्स हैज टू डू विद वॉमिटिंग एंड मोशन सिकनेस. माय डियर स्टूडेंट्स, एक सिंपल सा फंडा बताता हूँ, ध्यान से सुनो. whenever you are going in a like you are going for a mountain side drive. So you are going there, so the roads will be like this ऊपर चलते रहते. So during that time, during the movement, this is only called as motion. So during this movement, तुम्हारा एक system, your one system will be activated, that will be your vestibulocochlear. Vestibulocochlear system works by M cholinereceptors. M cholinereceptor. So that is why scopolamine is used as a DOC for motion sickness. मुझे जल्दी एक आंसर बताओ. That is most of the people will think after motion sickness is started we are going to use it, or before only, prior to the trip it is used in the form of transdermal patch. Anji, transdermal patch. See, if it was a PG class, transdermal patch itself, we would have learned it for 2 to 3 hours. That will be the least minimum. Okay, so that is not a post graduation MD pharma class. Rather, it is, or what is that? These are FMG class. Okay, now drug of choice for motion sickness will be transdermal patch. That is your scopolamine containing patch. Very good. Behind the ear, there is also reason behind the ear, because proximity to the site of action, and next important, clear surface area, etc. There are many other things. Yes, are yaad mat karna, then you will become confused. It is combined in the truth serum. Truth serum के अंदर बहुत सारे component होते हैं, ठीक है. One of the component है तुम्हारा, what is that? Scopolamine. The next important, in the CNS we have drugs in such as drug induced Parkinsonism. What is that? Drug induced Parkinsonism. So in the drug induced Parkinsonism, we are going to use what is that? Trihexyphenidyl. Okay, अब जल्दी में लड़ने को मत आना. We have another drug such as benztropine, and we have drugs such as benzhexol. So आप लोगों को, बहुत लोगों को ये पॉइंट तो रट लिए होंगे, benztropine, benzhexol, Parkinsonism. No, that is drug induced Parkinsonism. It is caused by which drugs such as antipsychotics. जो भी receptor CNS में dopamine receptor को block करते हैं, they can lead to drug induced Parkinsonism, and one of the classic symptoms is extrapyramidal symptom. याद हो जाएगा? Sure? कुछ तो बताओ यार, पक गए हो क्या? चलो, next important देखते हैं. CNS के बाद let's proceed into the next important, that is your heart पे चलते हैं. That's your heart. In the heart, which receptors are there? M2 receptor को stimulate करोगे तो there will be decrease of heart rate. M2 receptor को बंद करोगे there will be increase of heart rate. So that is why they are used in bradycardia. So in the bradycardia, the drug we are going to use, that will be your atropine. If I was the examiner, I would not definitely I would not ask the bradycardia का drug of choice क्या है. Rather, I would ask question, what is the drug used? ध्यान से देखो, drug used in AV block. हाँ, AV block के अंदर कौन सी drug use किया जाता है? I didn't ask you people what is the treatment. Treatment for the AV block, the best treatment will be cardiac catheterization. Agree with you people, okay? But I want you to understand, drug अगर पूछा गया atropine. Okay, then let's get into the next important aspect, GAT. My dear students, GAT के बारे में, GAT के अंदर M1 receptor है. M1 receptor exactly they are located. यार आप लोगों को ना, बहुत लोग ये ऐसा क्या बोल दिया पता नहीं, exact location बताना चाहिए. स्टोमक के अंदर स्मूथ मसल है, स्टोमक के अंदर स्फिंक्टर्स है, तो कंफ्यूज नहीं होना. पेराइटल सेल में होता है. M1 receptor को स्टिमुलेट करने से there will be increase of the HCl production. M1 को ब्लॉक करने से there will be decrease of the HCl production. We have drugs such as pyrazapine. What is that? Pyrazapine के अलावा we have drugs such as tilenzapine. But the only interesting fact here is that which cholinoblocker is used in peptic ulcer पूछा तो cholinoblocker AM1 blocker को मार्क करो, नहीं तो कोई फायदा नहीं है इनसे, because we have best drugs, they are your PPAs. If I ask you a question, tilenzapine बेहतर होगा और omeprazole बेहतर होगा for the treatment of increased acid production, the best answer will be your omeprazole. So these drugs are not used anymore because of there is a availability of the superior drugs. समझ में आ गया? थैंक यू, थैंक यू, थैंक यू। चलो, then next important aspect. The next important aspect, we have something called as a dicyclomine. Sir, what is this dicyclomine? Dicyclomine is used in a condition that is your colicky abdominal pain. Colicky abdominal pain. I will tell you people, your favorite, one of the favorite brand name for most of the doctors. It comes widely used under a brand name called as Buscopan, but that contains a component that is a dicyclomine. ठीक है, इसको याद रखने के लिए और एक तरीका बताता हूँ. The green color tablet which were given to us, the green color packing tablets which were given to us in the childhood for abdominal pain, they usually had contained dicyclomine. कौन सी सब्जेक्ट पढ़ा रहा हूँ वही ब्रांच है भाई मेरा. That's my branch. Okay, let's continue. Let's continue to the next important. चुन चुन के लिया हुआ branch है मेरे लिए. Then let's continue to the bladder. Why am I talking about bladder so separately? Now, when we are talking about bladder separately, there is a reason behind it. करते हैं यार, तुम लोग साथ दो, मैं कितने देर तक भी पढ़ा देता हूँ, तुम लोगों को बहुत अच्छे से पता है. ब्लैडर, बट मुझे एक रिस्पॉन्स चाहिए. होप एवरीबडी इज अंडरस्टैंडिंग और नॉट. जल्दी जल्दी बताओ. पक गए सर, हमने हमें नींद आ गया. ऑफलाइन होता तो काश और भी अच्छा होता. कोई बात नहीं, दिस एक क्विक सेशन, दिस इज वेरी यूजफुल. ऑफलाइन में होते तो बाद में देखने के लिए नहीं मिलता, ये यहाँ पे मिल जाता है. कैन गेट टू सी लेटर. So in the bladder, my dear students, there are some receptor called as M3 receptor, predominant one. There is one more receptor, there your alpha 1A receptor. Okay, in that M3, I want you to understand. If I stimulate M3, okay, these M3 receptors, if I stimulate, it will contract the bladder. अगर ब्लैडर को कॉन्ट्रैक्ट किया, कितने लोगों को ब्लैडर का कॉन्सेप्ट बिल्कुल ही समझ नहीं आता है सर. कॉन्ट्रैक्ट रिलैक्स में कंफ्यूज आता है. लिसन, ये मान के चलो ब्लैडर, अगर ब्लैडर ऐसा कॉन्ट्रैक्ट किया, सो इफ ब्लैडर कॉन्ट्रैक्ट्स लाइक दिस, ऑटोमेटिकली यूरिन विल come out. So if urine is coming out, that means contract the bladder will lead to urination. If I block M3 receptor, it will lead to relaxation of the bladder. Exactly the relaxation of which part of the bladder? That is your detrusor muscle. So relaxation which will lead to decreased frequency of urination, we can call frequency of urination. Why? Because there are other facts also, urge and etc. also sometimes involved by M3 receptor. Now frequency of urination is decreased. So what is the use of this drug? They are used in one condition. They are used in the hyperactive bladder. So for the hyperactive bladder, we have one more drug that is called as mirabegron. We have one more drug that is mirabegron. Mirabegron is a beta 3 acting drug. ये beta 3 के ऊपर काम करता है, तो सोच लेना beta 3 भी bladder में होते हैं. But we have other drugs which are M3 blockers. M3 blockers such as oxybutynin. We have drugs such as dorifenacin. We have drugs such as solifenacin. We have drugs such as trospium. My dear students, कहीं पे भी अभी तक ये proven नहीं है that M3 receptors, mirabegron will cause weight loss. This is according to the latest information which we understood and linked. Okay, apart from trospium, dorifenacin, dorifenacin, solifenacin, and your trospium, we have one more drug that is oxybutynin, and we have one more drug that is only called as tolterodine. अच्छा जी, ये हो गया तुम्हारा कोलिनो ब्लॉकर. खत्म कोलिनो ब्लॉकर सा. So listen to me very carefully. भाई इतना याद रखो, तुम्हारा ब्लैडर का 90%. चलो, we are done with what is that most complicated part of ANS, that is your cholinergic system. Let's continue. सी इट इज अभी तक, सी इट कैन अभी तक उतना प्रूवन नहीं है और तुम्हें ये पूछा भी नहीं जाए, ठीक है। यस इट इज कंसिडर्ड टू लॉस कॉज वेट लॉस, इट इज कंसिडर्ड टू वेट लॉस, बट कंप्लीटली प्रूवन नहीं है। अगर नहीं होता, अगर कंप्लीट पॉसिबल ऑफ वेट लॉस होता ना, देन कहाँ पे यूज किए होते तुम्हें पता है ना, जिम वाले जिम फ्रीक्स वुड हैव यूज्ड इट, बट द रीजन इज दैट इट इज नॉट एब्सोल्यूट वेट लॉस कॉन्सेप्ट। तो उतना सीवी मतलब उतना अटेंशन से तुम्हें ध्यान देने का जरूरत नहीं, तो इसलिए मैं बोल देता हूँ कि कहीं पे भी तुम्हें याद रखने की कोशिश, ठीक है जी। गॉट द पॉइंट। लेट्स कंटिन्यू टू द नेक्स्ट एस्पेक्ट। कौन सी है द नेक्स्ट एस्पेक्ट, दैट इज योर एड्रेनर्जिक सिस्टम। लेट्स स्टार्ट विथ योर एड्रेनोमिमेटिक्स। एड्रेनोमिमेटिक्स, एड्रेनोमिमेटिक्स होते क्या है? एड्रेनोमिमेटिक्स आर द ग्रुप ऑफ ड्रग्स, एड्रेनोमिमेटिक्स आर द ग्रुप ऑफ ड्रग्स इंक्रीज द sympathetic activity, increase the sympathetic activity. Okay, if they're increasing the sympathetic activity means they will stimulate alpha and beta adrenoreceptor. Alpha adrenoreceptors are further divided into alpha 1 and alpha 2. Beta receptors are further divided into beta 1, beta 2 and beta 3. As much as pharmacology is concerned, for our exam is concerned, beta 3 को ज्यादा, बीटा 3 रेसेप्टर अगर तुम बीटा 3 रेसेप्टर पे काम करवाओगे, द इफेक्ट विल बी व्हाट इज दैट, इसके ऊपर काम करने वाला ड्रग है मिराबैक्रोन, इज यूज्ड फॉर हाइपर एक्टिव ब्लड व्हिच विल डिक्रीज द यूरिनेशन, ठीक है, गॉट इट। तो बीटा 1 एंड बीटा 1 एंड बीटा 2, सो बीटा 1 इज लोकेटेड इन टू लोकेशन, हार्ट हो गया जी, ठीक है, एंड वन मोर लोकेशन इज योर किडनी। मोस्ट ऑफ यू फॉरगेट बिकॉज यू पीपल वर टॉट एज कार्डियो सेलेक्टिव ड्रग्स, तो प्लीज डोंट गेट कंफ्यूज्ड। वे बीटा 3 को मारो गोली। अल्फा रिसेप्टर की बात पे आते हैं। अल्फा रिसेप्टर्स आर फर्दर डिवाइडेड इनटू अल्फा 1 एंड अल्फा 2। अल्फा 1 रिसेप्टर इज फर्दर डिवाइडेड इनटू अल्फा 1a, अल्फा 1b। बहुत लोग सोचते हैं कि 1c होता है, बट देयर विल बी अल्फा 1d। आई वांट यू पीपल पे अटेंशन ओनली टू रिसेप्टर अल्फा 1 एंड 1b, ओके। देन वी हैव अल्फा 2 रिसेप्टर, इसके अंदर भी अल्फा 2a 2b 2c होते हैं, बट आई डोंट वांट यू पीपल टू वेस्ट योर टाइम एंड कंफ्यूज हियर। एंड बीटा 2 receptors are located in the 3 location, one of them is your bronchus, G bronchus, one of them is your blood vessel, another one is your what is that, bronchus, blood vessel and your uterus are the most important organs to be remembered. Yes, are they present in other locations? Yes, they are likely they are present in other locations जो important नहीं है, do not waste your time. Let's continue to the next aspect. What is the next important aspect which you need to understand? The next important aspect which I want you people to understand, let's start with the one important drug, that is adrenaline. When I'm talking about adrenaline, now listen to me very carefully. Adrenaline is a drug which is also a catecholamine present in the human body. Adrenaline will stimulate alpha 1, alpha 2, beta 1 and beta 2. So all the four receptors will be stimulated by adrenaline. So I want you to understand adrenaline. There is something called as vasomotor phenomenon of This vasomotor phenomenon is becoming a very favorite question in recent times. So please listen to me very carefully. Vasomotor phenomenon of the tails says that adrenaline at a high concentration. Remember, ध्यान से फिर से सुनो, 2-3 बार रिपीट करता हूँ. Vasomotor phenomenon of tails is applicable only and only on the blood vessels. Again, I'll tell, it is applicable only and only on the blood vessels. It is only on the blood vessel. Okay. So, high concentration, it will stimulate alpha 1 receptor of the blood vessel. At low concentration, it will stimulate beta 2 receptors. Okay. So, low concentration के अंदर beta 2 stimulate होने के वजह से vasodilation होगा. Vasodilation will be there. Okay. Hey, when I'm talking about alpha 1 receptors, when I'm talking about alpha 1 receptor, they will cause vasoconstriction. Vasoconstriction. When I'm talking about vasoconstriction, now please understand vasoconstriction will lead to increase of the blood pressure, but vasodilation will lead to decrease of the blood pressure. So with this much being said, let's continue to the next concept. The next important concept I'm going to teach you people about adrenaline. Adrenaline is the drug of choice for anaphylactic shock. Anaphylactic shock. Anaphylactic shock. Anaphylactic shock. What is the dose used? 1 in 1000. 1 in 1000 for intramuscular and the lateral vastus muscle. ठीक है. एड्रेनालिन क्यों यूज करते हैं एनाफिलैक्टिक शॉक में? द रीजन इज वेरी सिंपल. एनाफिलैक्टिक शॉक में बीपी कम होता है, ब्रोंकोकंस्ट्रिक्शन होता है, दोनों को रिवर्स करता है एड्रेनालिन. सो इन एनाफिलैक्टिक शॉक देयर इज अ वेसोडाइलेशन डिक्रीजिंग द बीपी, ब्रोंकोकंस्ट्रिक्शन लीडिंग टू difficulty in breathing, and there will also be a slight pharyngeal edema. And anaphylactic shock के अंदर the drug of choice will be, what is that? Intramuscular adrenaline. Okay, then it is also used in the local anesthesia. It is also used for the combination with local anesthesia, which will prolong the duration of local anesthetic, which can also be used in cardiac arrest. So please understand, blindly shock देते ये आंसर मत करना एनाफिलैक्टिक शॉक करके. अगर शॉक की बात चल रही है तो कौन सी शॉक है देखिए जी, उसके बाद आंसर कीजिए. Please look at the type of shock and then answer. Hope everybody is clear. So I want you people to respond. अभी 1 मिनट के लिए. I'll wait for a minute here. Yes, cardiac arrest 1 in 1 lakh. सब समझ में आ रहा है कि नहीं हो रहा है, या स्पीड हो रहा है? Everybody able to understand, or is it becoming speed, slow? Can you tell me please? Good. 1 in 1 lakh. बताओ, everything is fine? समझ में आ रहा है? I'm considering you people are understanding. जी, let's continue. So cardiac arrest में यूज किया जाता है. Apart from the cardiac arrest, adrenaline is a natural antagonist of histamine. Natural antagonist of histamine. New MCQ which is not usually present in our notes I'm giving. ठीक है, चलिए continue. Let's continue. What exactly we are focusing on? Next aspect, noradrenaline. My dear students, इतना याद रखो noradrenaline के बारे में. Whatever points I'm going to tell, if you remember this, definitely lays all the questions, all the MCQs which are asked in your exam. What is that? Noradrenaline, no significant change of adrenaline. Noradrenaline, no significant change of heart rate. Rule number 1. Why? Because it has no action on the beta 2 receptors. Beta 2 receptor के ऊपर action नहीं होता है. That is one of the reasons it will not have change of heart rate. So only and only it increases the blood pressure. That is why अगर कोई भी shock आया except for anaphylactic shock, you don't know what is going on. You need to increase the BP just and just. What is DOC for shock? ऐसे भी क्वेश्चन पूछा जाता है कभी-कभी. So the best drug for shock, without any consequence, without any information given to you, directly answer noradrenaline for shock. Okay, it has no action and no significant change of heart rate. Very important aspect. Narad over. Let's continue. Let's talk about dopamine. Dopamine shows something called as dose-dependent action. Dopamine shows dose-dependent action. Okay, dependent action. Now, apart from dose-dependent action, I want you to understand dopamine will cause vasodilation because of the D1 receptor. D1 receptors को stimulate करेगा. It will activate the D1 receptor that will lead to vasodilation. So that will lead to one important, decreases the blood pressure, and most importantly BP कम करने से BP, since it is having a dose dependent action D1 receptor के, and it will also increase the renal blood flow because renal vasculature contain dopamine receptors. Next important, it will increase the heart rate, so it can be used in cardiogenic shock. It can be used in cardiogenic shock. अगर heart rate को increase कर रहा है, that means it is a inotropic drug. Yes, it is a renal blood flow को बढ़ाने वाला drug. The next important aspect, what exactly I want you people to understand is that it will also increase the blood pressure by acting on the alpha receptors. Okay, these are the things I want you to remember. So if this dopamine will become DOC for any condition with that is your septic shock or any condition जहाँ पे oligouria with shock, the drug of choice will always be your dopamine. The reason is very simple यहाँ पे, क्योंकि oligouria के वजह से oligouria is a indicator which patient might going into the renal failure, उससे prevent करने के लिए we are going to use dopamine. Next, let's continue to the next important aspect. What is that? Alpha-1 agonist. Alpha-1 agonist. Alpha-1 agonist, I want you to understand phenylephrine. Phenylephrine. Sir, why everyone is focusing on phenylephrine? Simple. Alpha-1 receptors in the eye. Alpha-1 stimulation in eye will lead to mydriasis. यहाँ पे अभी कुछ पढ़ाया था मैं शायद mydriasis. But यहाँ पे one important concept is that no cycloplasia. Sir, why didn't you mention that? Because I was about to mention here. That's why. Then alpha-1 receptor stimulation will lead to mydriasis. Pupil will dilate. You can look into the eye. At the same time, no cycloplasia. Everybody taught us cycloplasia. What is cycloplasia? Ciliary muscles go into the paralysis. Is called as a cycloplasia. Cycloplasia is caused by cholinoblockers, not caused by phenylephrine. So mydriasis without cycloplasia, the answer is phenylephrine. It is causing a mydriasis without what is that? Without cycloplasia. Mydriasis without cycloplasia is only what is that? Phenylephrine. That is why a name a mydriatic without cycloplasia causing, that will be what? Phenylephrine. So phenylephrine will not cause cycloplasia. If there is no cycloplasia, near vision will not be affected as much compared to the cholinoblockers. That is why we are using phenylephrine. Clear, everybody? Let's continue. We understood about the phenylephrine. We have such as nasal decongestants. They are also alpha-1 agonist. Nasal decongestants. They are your oxy, xylometazoline and oxymetazoline. These metazolines, such as your Otrivin, whatever nasal drops you are going to use, they contain this nasal decongestants. The nasal decongestants are your what is that? Oxy and xylometazoline. Hope I'm clear so far. Alpha-1 agonist. Let's talk about alpha-2 agonist. So alpha-2 agonist, my dear students, understand. Alpha-2 stimulation in the nerves leads to the decrease of noradrenaline, adrenaline release. It decreases the release of noradrenaline and adrenaline release, because of which it will lead to decrease of the blood pressure. So alpha-2 agonists, they are used in hypertension. So the drugs are you have something called as clonidine. Okay, and we have one more drug, alpha-methyl-dopa. Alpha-methyl-dopa is very favorite question of our exam, because this drug is safe in pregnancy but not a drug of choice, but it can be safely used. Safe in pregnancy, it can be safely used in the pregnancy. That is why you need to understand alpha-methyl-dopa is a important question. Let's get into the next aspect. Once we understood about this, let's get into we have other drugs glaucoma में use करते हैं such as brimonidine is used in glaucoma. Okay, that means alpha 2 receptor not only in the nerve but they are also present elsewhere. Okay, समझ में आ रहा है कि नहीं आ रहा है? Everybody able to understand or not? Hope everybody is able to understand. Let me continue into the next important aspect. There is a beta agonist. I'm not going to waste your time on beta 2 agonist. All of you know beta 2 agonist. I'm not going to do sabalaba. Everybody know that. I'm only going to talk about the beta 1 agonist. Beta 1 agonist, we have a drug that has dobutamine. So dobutamine is better than dopamine. For which conditions? That is better than dopamine for cardiogenic shock. If I ever asked you people, what is the drug of choice for cardiogenic shock? Always try to find the answer as dobutamine. If you are not able to find the dobutamine, then dopamine will become answer. The best answer will be dobutamine. If somebody has said something, so please go through the notes properly, what content, in what context they have told you. If at all something else, the best answer will be dobutamine. Very good. Let's continue. When I'm talking about beta 2 agonist, yes, beta 2 agonist, I want you to understand beta 2 agonist. These are the drugs that are used in the bronchial asthma. Bronchial asthma में use किया जाता है and COPD में they are divided into short acting and long acting. Short acting drugs such as salbutamol and terbutaline. Then we have long acting drugs such as formoterol and salmeterol. These are the drugs which are beta 2 agonist and long acting drugs which you need to remember. All of you know that. If I ever ask you people directly and blindly without giving any history, nothing, what is the best drug for bronchial asthma? The best drug for bronchial asthma without any context, the first line drug always you need to answer, that is beta 2 agonist, that is your salbutamol, that is also SABA, you need to answer. कर लोगे या भूल जाओगे? I hope you will do the answer. Let's continue to the next important. There are adrenoblockers. अब प्लीज मत बोलना सर आप बहुत शॉर्ट में पढ़ा दिए कैसे आज. Of course यार, according to the situation we should also get used. हाँ जी, समझ में आ रहा है? ऐसा लग रहा है ना सर शुरुआत में everyone spoke to us and there was jokes and all this. Now faculty is becoming serious. Why? The reason they are not becoming serious, they are more worried about you than before. Okay, only difference is that time you people were trying to understand, build up your concept. Now is the time where you just require a quick glance of the information. So that is why we are going to be like this. Okay, फिर भी I am trying my best to be और कहाँ interact करने की कोशिश हमेशा रहेगा, but still I want your attention undivided during this period of time. चलिए आगे बढ़ते हैं. Next important adrenoblocker. We have something called as beta blocker. Beta blockers. So beta blocker के अंदर दो तरीके होते हैं, beta 1 and beta 1 blockers. So beta 1 blockers, we have drugs. All the laws I know that you people can answer. Beta 1 blockers का uses लिखते हैं. They are used in the tachyarrhythmias since they are decreasing the heart rate. Beta 1 blockers are used in glaucoma. Then beta 1 blockers are also used LAL drugs and will. So LAL drugs, tachyarrhythmia, yes, glaucoma, yes, they're used in chronic heart failure, but never in acute heart failure. But they are used in congestive or chronic heart failure because they increase the filling. अगर कोई question पूछ रिया why they are used in chronic heart failure, because they increase the filling. ठीक है, चलो आगे बढ़ते हैं, बीटा ब्लॉकर्स। बीटा ब्लॉकर्स और कहीं यूज होते हैं क्या? ग्लूकोमा, टैकियारिथमिया, ओके, congestive heart failure, and most important disease, one of them is your hypertension. These are the things you need to remember. Then when I'm talking about beta 1 plus beta 2 blockers, beta 1 plus beta 2 blocker, that is your non-selective blocker, that will lead to that drug is your propranolol. Propranolol will have so many questions, where to use and where not to use. First, let me tell you people where it is used. It is used in something called, it is devoted for essential tremors. Essential tremors. Sir, how will we understand essential tremor? A patient, young baby patient, came to the hospital with the complaints of tremors. During investigation, all investigations revealed normal. Still, he is having a tremor. CT, MRI of the brain, etc., etc. Nerve conduction, everything is normal. Still, he is having a tremor. What is the drug of choice? Yes, that is your propranolol. It is also used in the stage fear के time पे there will be anxiety के अंदर भी यूज करते हो, but there are anxiolytics also in this condition. और कहाँ पे यूज करते हो? It is also used in hyperthyroidism. अपार्ट फ्रॉम दैट और कहाँ पे यूज किया जाता है? हाइपरथायराइडिज्म के अलावा दिस प्रोप्रानोलॉल कैन बी कंसिडर्ड इन हाइपरटेंशन एज ए बीटा ब्लॉकर, बट इट इज नॉट द बेस्ट ड्रग. ओके, ऐसा कुछ बेस्ट नहीं है. यस, कैन बी कंसिडर्ड. ओके, बट मोस्ट इंपॉर्टेंट आई वांट यू टू अंडरस्टैंड हाइपरथायराइडिज्म, एसेंशियल ट्रेमर, स्टेज फियर, ये सारे कंडीशन यूज होता है. प्रोप्रानोलॉल not used in these conditions. They are your peripheral vascular diseases, such as atherosclerosis, such as Raynaud's syndrome. Okay, all these conditions we are not going to use. जहाँ पे भी blood flow कम रहता है वहाँ पे use मत किया करो, ठीक है. और कहाँ पे? Then it is also not used in bronchial asthma, क्योंकि बीटा 2 receptor को ब्लॉक करने की वजह से the patient will have repeated attacks of the bronchial asthma, इसलिए use मत किया करो. So these are the two important conditions which you need to recall before the exam for the bronchial asthma and peripheral vascular disease. Clear हो गया? चलो, once we understood about this, so except propranolol, most other lols are your beta 1 blockers. Okay, there are drugs such as the sotalol, for example. It has both beta 2 and beta 1 blocking property. Timol also same story. Okay, in glaucoma, best we have two drugs in glaucoma के लिए, timolol है, and we have one more drug that is your Vidoxil. ग्लोकोमा के अंदर यूज किया हुआ दो. Next important aspect, I will write it down here because this is a very important concept. There is one important concept called as migraine prophylaxis. In the migraine prophylaxis, what are the drugs used? The drugs used are propranolol. There was one question previously. Earlier it was asked, all of the following are used in migraine except. Okay, that's propranolol. Then we have tricyclic antidepressants such as imipramine. Then in migraine prophylaxis, what else is used? ट्रिप्टान्स आर यूज्ड इन द ट्रीटमेंट ऑफ माइग्रेन. मतलब एक्यूट पेन के अंदर सुमेट्रिप्टान यूज करके हम लोग यूज करते हैं पेन कम कराने के लिए, बट दे आर नॉट यूज्ड फॉर द प्रोफिलैक्सिस. ठीक है. टीसीएस, प्रोप्रानोलॉल, एनीथिंग एल्स? अर्लियर एयरगोड्स यूज करते थे, अभी एयरगोड्स भी यूज नहीं किया जाता है. एंड मोस्ट इंपॉर्टेंटली आई वांट यू टू अंडरस्टैंड, वैल्प्रोएट भी यूज किया जाता है, वैल्प्रोएट एंड टॉपिरामेट. बट आई वांट यू टू रिमेंबर these two drugs. I want you to remember ये दो drugs, TCA and propranolol. These are the two important drugs. Okay, even if you remember or not remember, I don't mind this valproate and topiramate, but TCS and propranolol I want you to. Okay, चलिए. Paracetamol and NSAID, देखो, that is what I am trying to tell you people. Prophylaxis मतलब, so we are preventing the next episode of migraine headache. अगर किसी को migraine headache, if it is actively present, that time you used that is your sumitriptan and your paracetamol and other NSAIDs, ठीक है. बट हेडेक को कम कराने के लिए, बट हेडेक नेक्स्ट टाइम आने से प्रिवेंट करने के लिए, दैट इज योर प्रोप्रानोलोल एंड TCS आर यूज्ड, ठीक है. Diltiazem is a calcium channel blocker doctor. It is a class 4 anti-arrhythmic drug, ठीक है. क्लास 4 एंटी-अरिथमिक. चलो कमेंट देख लिया मैंने, आगे बढ़ते हैं. नेक्स्ट पार्ट, व्हाट इज दैट नेक्स्ट इंपॉर्टेंट एस्पेक्ट? द नेक्स्ट इंपॉर्टेंट एस्पेक्ट वी हैव अल्फा प्लस बीटा ब्लॉकर्स. अल्फा प्लस बीटा ब्लॉकर. अल्फा प्लस बीटा ब्लॉकर्स वी हैव लेविटलॉल. Levetolol is the drug of choice for pregnancy hypertension. Drug of choice for pregnancy hypertension. That is why this becomes very important question. Apart from that, we have one more drug, that is carvedilol. Not celiprolol, carvedilol. Alpha plus beta blocker. We are done with the beta blockers. Let's go to the alpha blockers. Alpha blockers. Alpha blocker के अंदर there are two types. Alpha 1 plus alpha 2 blocker. Alpha 1 and alpha 2 blocker. Alpha 1 and alpha 2 blocker is the best. These are the drugs divided into reversible acting. रिवर्सिबल मतलब अगर ड्रग का ड्यूरेशन ऑफ एक्शन खत्म हो जाएगा तो रिसेप्टर फिर से एक्टिव होता है. द रिसेप्टर विल बिकम एक्टिव अगेन आफ्टर द ड्रग इज गॉन आउट ऑफ द बॉडी. दे आर ओनली रिवर्सिबल. वी हैव वन ड्रग कॉल्ड एज फेंटोलामाइन. We have one more drug called as tolazone. What is that? Tolazone. Okay, these two drugs, there is irreversible drug. Irreversible is the long acting drug, that is your कार्डियोसेलेक्टिव की ट्रिक कुछ नहीं है. देखो लेबिटलॉल, कार्वेडिलॉल, प्रोप्रानोलोल तीनों हटाओ, बचा हुआ कार्डियो पे काम करते हैं, ठीक है. उतना ही. तुम ज्यादा टेक्निक बनाओगे ना, कौन सी टेक्निक किस लिए बनाए थे वो भी भूल जाओगे. दैट्स व्हाई इतना निमोनिक शुरुआत से पढ़ लिए फिर भी हमें याद नहीं होता. द रीजन इज दैट इज व्हाई आई एम फोकसिंग हियर ना जी. इरिवर्सिबल प्राजोसिन नहीं है, फेनॉक्सीबेंजामाइन. ठीक है. प्राजोसिन नहीं है, फेनॉक्सीबेंजामाइन. फेनॉक्सीबेंजामाइन इज यूज्ड. कहाँ यूज होता है फेनॉक्सीबेंजामाइन अलॉन्ग विद प्रोप्रानोलोल. बहुत लोग बोलते हैं कि सर अलॉन्ग विद प्रोप्रानोलोल. देखो अगर सिंगल बेस्ट ड्रग पूछा तो फेनॉक्सीबेंजामाइन. सिंगल बेस्ट ड्रग पूछा तो फेनॉक्सीबेंजामाइन. अगर बेस्ट कॉम्बिनेशन पूछा अलॉन्ग विद प्रोप्रानोलोल यूज्ड इन पियोक्रोमोसाइट. Next MCQ. If phenoxybenzamine used alone, ये सिर्फ अकेले को, if you use it alone in pheochromocytoma, that will lead to patient will immediately go into the severe degrees of the blood pressure. Patient might even end up into what is that, hypotensive and shock also, because of the beta 2 action. That is why I want you to understand, कहीं पे भी फियोक्रोमोसाइटोमा में अकेले यूज मत किया करो फेनॉक्सीबेंजामाइन. उसके साथ में प्रोप्रानोलोल को कंबाइन करो. अगर सिंगल ड्रग पूछे तो फेनॉक्सीबेंजामाइन, कॉम्बिनेशन पूछा तो पीपी, दैट इज फेनॉक्सीबेंजामाइन विद प्रोप्रानोलोल. ठीक है जी, बिल्कुल. दैट इज वाई BP डिक्रीज हो जाएगा. वेरी गुड. Okay, so if the patient is having such as clonidine withdrawal, and one more condition, that is your cheese reaction. What is that? Cheese reaction is caused by which component? That is tyramine, which is present in food and wines. That is in these condition we are going to use phenetlamine, short acting drug को use करते हैं. ठीक है. चलिए अगर पेंटलामाइन नहीं दिया था ऑप्शन में, देन यू कैन गिव द नेक्स्ट इंपॉर्टेंट वन. दे आर योर अल्फा 1 ब्लॉकर. अल्फा 2 ब्लॉकर एक केमिकल होता है योहिम्बाइन, जो अप्रूव्ड नहीं है तो यूज नहीं किया जाता है, कहीं पे भी अप्रूव्ड ड्रग नहीं है वो. सो अल्फा 1 ब्लॉकर, आई वांट यू टू अंडरस्टैंड, अल्फा 1 ब्लॉकर्स आर डिवाइडेड इनटू अल्फा 1a ब्लॉकर, then alpha 1a plus alpha 1b, alpha 1a plus 1b blocker. These two are different things. So alpha 1a blocker used to treat symptoms of the BPH, symptoms of the BPH, symptoms of the BPH. But alpha 1a plus 1b blockers are used in the BPH with hypertension, BPH with hypertension, because alpha 1a receptors are located in the bladder. So that is why we are blocking that receptor ताकि patient can urinate better. ठीक है, अल्फा 1a प्लस 1b, अल्फा 1a ब्लैडर, अल्फा 1b ब्लड वेसल में होते हैं, जिसके वजह से हाइपरटेंशन विद बीपीएच है, तो दिस विल बी द बेस्ट ड्रग्स. तो रिमेंबर माय डियर स्टूडेंट्स, द ड्रग्स आर प्राजोसिन, अल्फा 1a प्लस 1b ब्लॉकर के लिए ड्रग्स आर प्राजोसिन. वी हैव ड्रग्स सच एज अल्फुजोसिन, अल्फुजोसिन. ठीक है. नाउ इंपॉर्टेंट एस्पेक्ट, प्राजोसिन इज यूज्ड इन वन मोर कंडीशन, दैट इज योर स्कॉर्पियन बाइट. The next important, alpha 1a blocker. Alpha 1a blocker, the drug is tamsulosin. What is that? Tamsulosin. ठीक है. Now, finasteride, option B. बताओ, drug of choice for BPH, finasteride or tamsulosin? I want an answer because many of you make the mistake, ताकि आज ये mistake को break कर देते हैं. Okay, some of you are saying finasteride. Another, Dr. Shubham says finasteride, Dr. Imran. Okay, और लोग बताओ भाई, क्या लगता है आप लोगों को? व्हाट इज द बेस्ट? द ड्रग ऑफ चॉइस हमेशा फिनेस्ट्राइड है. ड्रग ऑफ चॉइस इज ऑलवेज वेरी गुड. द ड्रग ऑफ चॉइस इज ऑलवेज फिनेस्ट्राइड. ठीक है. नहीं जी, टैम्सुलोसिन यूज्ड टू ट्रीट द सिम्टम्स. सिर्फ सिम्टम को ट्रीट किया जाता है इससे. ठीक है, सिर्फ सिम्टम को ट्रीट किया जाता है. आज के बाद गलत मत करो. सी, अल्फा 1 रिसेप्टर स्टिमुलेट करने की वजह से ब्लैडर का माउथ ऐसा बंद हो जाता है. अगर अल्फा 1a रिसेप्टर को मैं ब्लॉक कर दिया तो ब्लैडर ऐसा खुल जाता है. That's it is done by tamsulosin. Bladder sphincter contracts and relaxes because of alpha 1a receptor. But finasteride will prevent the enlargement of the prostate by inhibiting something called as, it will inhibit an enzyme called as 5-alpha reductase. 5-alpha reductase is inhibited by this. ठीक है. Please understand, confuse मत होना. Everybody, I am breaking most biggest confusion many of us will have. Finasteride is used for the treatment. This is used for the symptomatic management. Very good, क्योंकि 5-alpha reductase inhibit करने की वजह से there will be decrease of dihydroxy testosterone which will cause the enlargement of the prostate. ठीक है जी, याद हो जाएगा. होप एवरीबडी इज क्लियर सो फार. ठीक है, चलो आगे बढ़ते हैं. then yes, hair loss, this is also used in one more condition, that is androgenic alopecia. इट इज ऑल्सो यूज्ड. ठीक है, एंड्रोजेनिक एलोपेसिया में 2 ड्रग यूज किया जाता है. वन ड्रग इज योर मिनॉक्सिडिल टॉपिकल एप्लीकेशन. अगर सिस्टेमिक ड्रग, सिस्टेमिकली अगर कोई टैबलेट फॉर्म में सिस्टेमिकली देना चाहते हो तो दैट इज योर फिनेस्ट्राइड. ओके, सो विद दिस मच बीइंग सेड, अल्फा ब्लॉकर के वजह से there will be something, the dangerous side effect with the alpha blocker, that is your what is that, Hanji? Thank you so much. It's very happy and biggest motivation for me also to hear this. Okay, listen, the alpha blockers will cause a side effect. Definitely, I'll tell you people. You able to understand how much important? Listen to me. It will cause something called as first dose effect. First dose effect. So first dose effect. This first dose effect is the most important side effect. There are others which can affect eye, which can affect which can lead to retrograde ejaculation, etc., etc. And all. I'm not saying no. This first dose effect is a examiner's and a clinically important question. The first dose effect is only your orthostatic. Please pay attention. Hypotension, orthostatic hypotension, not orthostatic hypertension. So please understand orthostatic hypotension. Orthostatic hypotension is the most important side effect. It will also cause other things, I agree. So they'll give a question. A 67-year-old male was given a drug for the management of difficulty in urination and elevated blood pressure. Later, patient came back to the hospital with the complaints of becoming dizzy after waking up and walking immediately. What drugs are these? They are your alpha blocker. Exactly word to word भी आ सकता है, मतलब same meaning में. That is your alpha blocker lead to first dose effect. Hypertension नहीं है, rebound hypertension, okay, but orthostatic hypotension. Okay. This is your story. Let's continue. So first dose effect, that's done. Apart from that, there is retrograde ejaculation. Okay, iris back करता है. Yes, I agree. Suddenly stop करने से there will be elevated blood pressure. All those things over. Okay, but this is important. Alpha blockers are done. Once we are done with the alpha blockers, the most important I want to teach you people is your central nervous system. देखो, I will be covering up such kind of concept जहाँ पे आप लोगों को मैक्सिमम कवर अप हो जाए, एंड एंड मोमेंट में अगर कुछ भी रिवाइज करना है तो क्या रिवाइज करनी है, ऐसी चीजें रिवाइज करना. होप एवरीबॉडी इज अंडरस्टैंडिंग द कांसेप्ट. सीएनएस से 3 से 4 क्वेश्चन आते हैं भाई. अब अगले 10-15 मिनट से 20 मिनट के अंदर फटाफट से सारे ट्रैक्स आपको करवा देता हूँ ताकि आप लोगों के सारे एमसीक्यू क्लियर हो जाए. So I'm hoping that you people will take a complete benefit of this, but still I want you people to let me know one important thing, that is able to understand or not. क्योंकि मैं अगर शुरू हो जाता तो I'll become like fast little bit, फिर आप लोग कहीं मिस ना हो जाए. That's why. जी, can I continue? So let's start. Let's start. What is that? यार पार्किंसनिज्म. यार सीएनएस आते पहले शुरू करो ना. Opioids. See, opioids are the group of drugs. They stimulate opioid receptor. They stimulate opioid receptors. What is that? They stimulate opioid receptors. If they're stimulating opioid receptors, that means they are your agonist drugs. जी, ध्यान से देखना, ये बहुत इंपॉर्टेंट ट्रैप है. एगोनिस्ट है कि एंटागोनिस्ट, एग्जाम के दिन सुबह घंटा याद नहीं आने वाला है, तो ध्यान से देखो. व्हाट इज दैट? दैट इज योर ओपियाइड. There your कितना receptor होता है ओपियाइड के अंदर? There is something called as mu, there is something called as kappa, there is something called as a delta. ठीक है, जिसके वजह से क्या क्या होता है. If I stimulate these receptors, I'm not going to segregate the effects. I just want you to understand the effects as such. They decrease the pain. They will cause addiction by causing euphoria. Then next important aspect, apart from that, they'll cause constipation. But most important aspects I want you to understand, they are your constipation के अलावा they decrease your respiratory rate and also cause cough suppression. ठीक है. Along with that, these drugs will also cause one more important thing, that is only called as meiosis. ये सारे करवाते हैं. ठीक है. Now Now, listen to me very carefully. Endorphin, enkephalin, these are the opioids. They are endogenous opioids. जो बात के अंदर, body के अंदर से produce. They are produced from inside of your body. They are your opioids. They are endogenous opioids. We are talking about exogenous opioids. My dear students, opioid agonist के अंदर we have some drugs which I want you people to understand. This is a little bit different approach, little unorthodox भी लग सकता है आप लोगों को पढ़ते हुए. We have a drug morphine. We have a drug morphine. Okay, we have a drug morphine. We have a drug, I want you to understand, codeine. Okay, we have a drug that is your fentanyl. Okay, we have one more drug that is methadone. Okay, इसके अलावा we have one more drug, tramadol. जी हाँ, बहुत लोगों को, many people are thinking, अरे कहीं सुना हुआ लग रहा है यार tramadol. Tramadol is there. Okay, now listen to me very carefully. Morphine is a prototype drug. ध्यान से देखो, prototype drug means कहीं पे भी प्रोटोटाइप बोलूंगा, that drug will possess all the properties of that group. That is only morphine as a prototype drug. Okay, now when I'm talking about codeine is a classic example of active drug. This is an active drug which will give rise to active metabolite. उसका active metabolite कौन होता है पता है? That is your morphine. This is a very important question from your general format. That is active drug to active metabolite. Active drug to active metabolite of codeine is that is your morphine. Okay. Now degree of analgesia. You got the logic why degree of analgesia comes for that. The degree of analgesia comes from its active metabolite. Codeine will also cause cough suppression. Right now it is banned. It is banned in many places, but it was used for earlier dry cough के लिए. Okay, fentanyl क्या होता है? It is one of the potent opioid. This potent opioid in the form of a patch. It is in the form of a patch used for कैंसर पेशेंट, टर्मिनल पेशेंट्स के अंदर बहुत पेन होते हैं, जिसको मैनेज करने के लिए हम लोग यूज करते हैं फेंटनिल. मेथाडोन कहाँ पे यूज होता है? ओपियॉइड एडिक्शन में, ओपियॉइड एडिक्शन को मेंटेन करने में मदद करता है. ठीक है. ओके, ट्रेमाडोल क्या होता है? इट इज अ टाइप ऑफ सिंथेटिक ओपियॉइड. So guys, you don't have to remove your comments. आपको कोई जज नहीं करने वाला. You don't have to remove your comments. Yes, I do pay attention towards your comments also. ठीक है, कहीं कुछ ऐसा नहीं कर रहा हूँ कि मैं नहीं देखता हूँ. ओके, सो ट्रेमाडोल इज यूज्ड इन, ट्रेमाडोल और कहाँ पे यूज होता है? EMI में यूज होता है पेन मैनेजमेंट के लिए एंड अदर पेन्स के लिए. जहाँ पे NSAID यूज नहीं कर सकते हो, यू कैन यूज SOS फॉर द इमरजेंसी. ओके, नाउ लिसन टू मी, दीस आर द थिंग्स. मॉर्फिन, यस, इट इज अवेलेबल इन द फॉर्म ऑफ टैबलेट्स ऑल्सो. Okay, now morphine, codeine, fentanyl, methadone, tramadol. I want you to remember these drugs. ये सारे कहाँ पे यूज होता है? All these drugs are general uses. Pain, okay, pain के अलावा they are used in labor, and ये भी क्वेश्चन आ सकता है. These drugs prolong second stage of labor. What happens in second stage of labor? प्रोलॉन्ग. इसका साइड इफेक्ट इफ यूज्ड इन द लेबर के टाइम पे, पेन मैनेजमेंट के लिए, पेनलेस लेबर आज के टाइम पे फैशन है ना, उसको मैनेज करने के लिए अगर यूज करोगे तो सेकंड स्टेज ऑफ लेबर को प्रोलॉन्ग कर सकते हैं. दैट कैन बी द साइड इफेक्ट. सेकंड स्टेज ऑफ लेबर में क्या होता है? सेकंड स्टेज ऑफ लेबर में फर्टिलाइजेशन होता है क्या? नहीं होता है. गलती से हाँ मत बोल देना. सेकंड स्टेज ऑफ लेबर देयर विल बी डिलीवरी ऑफ द fetus. दैट स्टेज विल बी प्रोलॉन्ग्ड. Then they're used in EMI pain management. They're used in cancer pain management. Okay, they're used in other conditions of pain management, such as trauma. Trauma पे use कर सकते हो. This is the story of your opioids. Opioid का overdose. अगर any patient has a opioid overdose, I want you to look for these three symptoms: decreased respiratory rate. Okay. Then injection marks on the body. Injection marks because opioid overdose होते हैं addicts में, addicts गलती से लिए होते हैं. Okay, injection marks on the body. Then patient will have pinpoint pupil. Okay, pinpoint pupil के अलावा apart from pinpoint pupil, injection marks will be there, respiratory will be suppressed. So if they are there, the treatment will be always naloxone. नैलेक्सोन होता क्या है? ओपियाइड एंटागोनिस्ट। अर्लियर टाइम में ये भी पूछा गया था, ओपियाइड एंटागोनिस्ट का मैकेनिज्म बताओ, नैलेक्सोन का मैकेनिज्म बताओ। हाईवी नैलेक्सोन, नैल्ट्रेक्सोन नहीं है, नैल्ट्रेक्सोन इज नॉट यूज्ड फॉर ओवरडोज ऑफ ओपियाइड। लेटर मैनेजमेंट। देखो अब कंफ्यूज मत होना, एडिक्शन अलग होता है, ओवरडोज अलग होता है। ओवरडोज से इमरजेंसी, अरे पहली बार नशा किया था उसने, उसको पता नहीं था, ज्यादा ले लिया ओपियाइड को, ठीक है, दैट टाइम इट लीड टू ओवरडोसिंग, ठीक है। Very good. Everybody understood so far? Let's continue. We understood about all these stories of opioid. Then once we understood about the opioid, let's go to the next important aspect. So there is other things. We have a drug, buprenorphine. ये बहुत confuse होते हैं। buprenorphine. ये होते क्या है? Yes, maintenance में naltrexone. What is buprenorphine? What is bupropion? Then I want you to tell me what is larcoserine. We have one more drug, filbanserin. What are these drugs? bupropion is used for smoking cessation के लिए, स्मोकिंग को कम करवाने के लिए, स्मोकिंग cessation. स्मोकिंग सिसेशन। बुप्रीनॉर्फिन होता है ओपियोइड। लार्कोसिरिन इज यूज्ड इन ओबेसिटी। फिलिबैंसेरिन इज यूज्ड कहाँ पे? भाई इसको स्क्रीनशॉट लो, जैसे मैं लिख के खत्म करूंगा ना चारों का यूज, फटाफट स्क्रीनशॉट लेके रखो ताकि ओपन करते ही समझ में आ जाए। It is a combined mixed agonist antagonist type of opioid. Larcoserine obesity के लिए it is not a opioid, it is a serotonergic drug. Since I remembered it here, I am finishing it up. Filbanserin is used in females. They with who has loss of libido. If the female has a loss of libido, who is having a loss of libido, to treat this, treatment of used in the treatment of female who has a loss of libido. For that people we are going to use filbanserin, larcoserine, filbanserin, buprenorphine. उठाओ स्क्रीनशॉट, फटाफट से लगाओ, ठीक है, अब लगाओ स्क्रीनशॉट। Okay, once you are done with that, let me continue. Then next important ones I want to tell you people, next ones which I want to tell you people are antipsychotics का कहानी क्या है? antipsychotics के अंदर see, you might be asking, sir, why are you focusing on CVS, CNS, ANS? So the reason is that I'll be focusing on these topics only. The major reason is that these topics you people will forget. Other things you might have remembered because there are many of based things, those you might remember, but so understanding concept I'm focusing more ताकि आप लोगों को समझ आए। When I'm talking about antipsychotics, they block D2 receptors. Okay, that is why we are using them in the treatment of psychosis. Okay, so apart from these antipsychotics are divided into typical, these are purane ones, old ones. We have one more drug, they are atypical. We have atypicals are the new ones. Atypical drugs, we have a drug called as clozapine. It has 2 MCQs. It is used in resistant schizophrenia. So any patient who is not having response to the normal antipsychotics, we can go for clozapine, which is used in the resistant schizophrenia. It can cause, इसका side effect एक होता है, that is your wet pillow syndrome. These are the two important MCQs. Okay. Then we have next important drug, that is olanzapine. Olanzapine कहाँ पे काम आता है? Olanzapine is used in the pregnant female with psychosis. Pregnant female with psychosis. So pregnancy के अंदर among all the other drugs, the safer ones is olanzapine. Okay, so we have olanzapine, we have clozapine. These are two important drugs which comes as an MCQ. There are other drugs, but two important ones I wanted to focus. Typical antipsychotics. We have a drug called as chlorpromazine. Chlorpromazine. Okay, chlorpromazine के अलावा we have other drugs such as haloperidol. Haloperidol. We have haloperidol. So chlorpromazine will lead to a side effect, that is your cholestatic jaundice. What is that? Cholestatic jaundice. But haloperidol is a older antipsychotics जो आज भी use होता है, but these are the newer ones. Okay, so these are very important for MCQs. Next important, it will decrease the suicide tendency. Clozapine will decrease the suicide tendency. Apart from decreasing of the suicide tendency, these drugs, antipsychotics will also do one more thing. They will cause one of the most, this especially clozapine, which can be used safely for both positive or negative symptoms of the psychiatry. Means positive symptoms, negative symptoms. You might have read in psychiatry. Depression, loss of interest, all these are negative symptoms. Mania, hallucination, all of these are positive symptoms. Okay. Now, next important point I want you to understand, my dear students, please understand here. So these all the antipsychotics will cause some side effects such as increase of prolactin, and they will cause extrapyramidal symptoms. Okay, then I want you to understand least one. Yes, least one is clozapine, I agree, but extrapyramidal symptoms can be seen with all of them possible. Okay, then they can also cause drug-induced Parkinsonism. Drug-induced Parkinson can occur. Drug-induced Parkinsonism occur. Okay, this is also possible. Prolactin, extrapyramidal symptoms, drug-induced Parkinson. Okay, now I want you to understand, अगर कहीं पे भी prolactin बहुत नहीं बढ़ रहा है, so they might lead to what is that? Amenorrhea in the female. They might lead to amenorrhea in the female. Then they can also lead to one more thing, that is what we call as neuroleptic malignant syndrome. What is this neuroleptic malignant syndrome? Neuroleptic malignant syndrome is caused by antipsychotics. These antipsychotics, why they lead to neuroleptic malignant syndrome? Because they block the D2 receptors, which are located in a place called as thermostat region of your brain. So that is leading to triggering of the neuroleptic malignant syndrome. Okay, so this is only the most important aspects which you need to remember from the aspect of your G, that is your antipsychotics. Once we are done with the antipsychotics, let's go to the Parkinson's disease. So Parkinson's disease is very easy to understand. What is this Parkinson's disease? So Parkinson's disease के बारे में समझने के लिए I want you to focus here on single picture. I'll try to explain everything. Okay, so listen to me. Here we have this one. Let's consider this is your blood-brain barrier. Okay, so we give a drug levodopa. कहाँ पे दिए? Levodopa periphery. Levodopa देते ही this levodopa will converted with the help of dopa decarboxylase. It will converted into dopamine. It will get converted into dopamine. So dopamine, will it be able to cross the blood-brain barrier? No crossing of the blood-brain barrier. There is no crossing of the blood-brain barrier. By what? Dopamine. Dopamine will not cross the blood-brain barrier. Rather, levodopa can cross the blood-brain barrier. So we need to do two things. One thing what to be done? Inhibit DDC by carbidopa. So carbidopa, will it cross the blood-brain barrier? No. Carbidopa does not cross the blood-brain barrier. Levodopa will cross the blood-brain barrier. Carbidopa will inhibit dopa decarboxylase. Now levodopa came here. Now levodopa will get converted into dopamine. So dopamine will go and act on the receptors. Which receptors? Of course, it is your dopamine receptors. So when we are talking about dopamine receptors, think here, listen carefully. Now, dopamine receptors, if it is acting, so dopamine can get metabolized by two enzymes. One enzyme is MAO-B. One enzyme is MAO-B. Another one is your COMT into dopamine metabolites. So MAO-B is inhibited by a group of drugs. COMT is also inhibited by a group of drugs. So MAO-B is inhibited by drugs such as selegiline or rasagiline. This is your MAO-B. COMT inhibitors are capones. They are your capones. They are your N2-capone. Then we have one more drug, that is your tau-capone. Okay, these two drugs are your, what is that? COMT inhibitor. So if I'm talking about dopamine receptor, so if we are talking about dopamine receptors over here, dopamine receptor directly we can stimulate with the help of agonist. Dopamine agonist, I want you to focus here. Dopamine agonist, we have drugs such as bromocriptine. Okay, bromocriptine के अलावा we have one more drug. We have one more drug, that is cabergoline. So I want you to understand bromocriptine is such a drug. Bromocriptine is also approved for diabetes mellitus. Recently it is approved for treatment of diabetes mellitus. Okay. Then cabergoline is best for prolactinoma apart from Parkinsonism. So Parkinsonism में तो ये दोनों यूज कर सकते हो. Bromocriptine और cabergoline can be used in Parkinson. Okay, but apart from that, these are the things. तो ये दोनों तुम्हारे MCQ. So best for prolactinoma is cabergoline. अगर ऑप्शन में bromocriptine में है, cabergoline भी है, best answer will be cabergoline since it is a long acting. Okay, please don't get confused. Okay, so cabergoline is a long acting drug, that is why it is best used in prolactinoma. Okay, so anywhere dopamine receptors, if D2 receptors are stimulated, that will lead to decrease of the prolactin production. इसके वजह से बेहतर हो जाएगा. That will be what is that? That will be your treatment. So these are the important drugs. We have one more drug which increase the availability, dopamine availability, increase the availability of dopamine, that is done by your antiviral drug amantadine. Okay, amantadine will increase the availability of the dopamine. Got it? समझ में आ गया? Once you understood about the Parkinson drugs, also, now listen to me very carefully here, my dear students. So I'm going to talk about only antidepressant के अंदर. I'm not going to waste your time with the mechanism, AO and all those stuff. I'll talk about only few important concepts. Antidepressants are used in depression, agreed, but apart from that, there are some importance I want you to understand. We have something called as SSRIs, such as fluoxetine. Okay, fluoxetine कहाँ पे काम है? Fluoxetine depression के लिए तो use है ही भाई. Antidepressant का use is there for depression. Apart from that, fluoxetine or SSRIs are used in psychogenic premature ejaculation. Sir, in forensic and in psychiatry it was told most common cause of premature ejaculation is psychogenic. So if I'm telling psychogenic premature ejaculation is the most common premature ejaculation, तो उसका treatment पूछेंगे तो treatment के अंदर psychogenic premature ejaculation का treatment के लिए लिख लो भाइयों. That will be, my dear guys, everyone write down, that will be what? Premature ejaculation, that will be of fluoxetine. Okay, so this is a psychogenic premature ejaculation, and fluoxetine can be used also in PTSD. It is also considered in PTSD. Okay, fluoxetine. Okay, so this is your SSRIs, and most importantly, I want you to remember about tricyclic antidepressants such as nortriptyline, नॉन ट्रिप्लिन के अलावा we have imipramine. We have one more drug, that is your amitriptyline. That's your amitriptyline. So what are these drugs? Already I told you people, all these drugs, tricyclic antidepressants, are used for migraine prophylaxis, because this is a very favorite question. It was asked. Migraine prophylaxis, already in the starting part of the class, already I told you people, prophylaxis. Then we are also using it in migraine prophylaxis. We are also using it in nocturnal anuresis. And most important aspect, it can also be, especially imipramine alone, can be considered in can be considered in that is hyperactive bladder. Okay, hyperactive bladder. And I will tell you people, if you are going to get confused, it is typically approved information from the textbook of Qrs and Pharmacology. From there it is a reference. From there the reference is taken. Okay, but उतना improve important नहीं है. I want you to focus here, दो important. ठीक है, अगर कहीं पे भी कोई बोलेगा नहीं ये वो वगैरह बोलेंगे ना, सीधा बोल दो कि भाई Qrs and बुक से दिया हुआ है. ठीक है, Qrs and टेक्स्ट बुक. So once we understood about this, we have the drugs, that is your SNRS, that is venlafaxine. But most important, these are the MCQs. समझ में आ गया कि नहीं आया ना, कुछ तो बताओ ताकि मैं आगे बढ़ सकूं. Guys, please tell me something. Able to understand or not? हाँ जी, let me see. यस बताओ, देखते हैं क्या रहा है. यस प्लीज टेल मी यार. ओके, सो होप वेरी गुड. या परफेक्ट, लेट्स कंटिन्यू. चलिए आगे बढ़ते हैं. ओके जी. कभी कभार 1-2 सेकेंड का बात हो जाता है, मतलब स्पेशली दैट फोन व्हेन इट इज चेंजिंग दिस डायरेक्शन हो जाता है. लेट्स कंटिन्यू टू द नेक्स्ट इंपॉर्टेंट drugs. They are your anti-epileptics. When I'm talking about anti-epileptics के अंदर epileptics, I'm not going to waste your time by telling all the unnecessary stories of types of seizure. वो सारे मेडिसिन में पढ़ लिए तुम. I will tell you some of the most important aspects. My dear students, write down the most important ones. See, we have seizure. Seizures are divided into focal and generalized. Generalized के अंदर tonic seizures, clonic seizures, myoclonic, then tonic-clonic. In generalized, in these are generalized. In the focal, we have simple, complex, partial, all these things. But when I'm talking about anti-epileptics, I want you to understand what are the important aspects. We have a drug. We have some drugs. These drugs have a multiple mechanisms. ठीक है, मतलब most of the anti-epileptics mechanisms vary होते रहते हैं. So that's why you don't get confused and don't put your much of the focus there. So I want you to understand, if at all patient is having a status epilepticus के अंदर the first line drugs are benzodiazepine. That benzodiazepine best drug is lorazepam. अगर ऑप्शन में नहीं है तो go for midazole. Okay. Then if status epilepticus में if that fails, then you can go for other drugs. Phenobarbital. Okay, phenobarbital. Okay, if that also fails, then Okay, clear? So any patient who is having seizure in front of your eyes are status epilepticus ban. Loras, okay. Next question. Next important question is that I want you people to understand pregnant female with history of seizures. With the history of seizures. Pregnant female with history of seizure get pregnant. What is the best drug? What is the best drug? Best drug will be your lamotrigine. You can use levetiracetam. ठीक है? Lamotrigine or levetiracetam. Now, lamotrigine or levetiracetam. Okay. Lamotrigine or levetiracetam. Anyone can be used. Then, then we will continue. See, levetiracetam का mechanism of action. This can be your MCQ. Mechanism of action. Mechanism of action is it will inhibit SV2A protein. SV2A protein on the vesicles. Synaptic vesicle पे एक प्रोटीन होता है SV2A, which is the best one. The best one will be levetiracetam. Okay, but आपको दोनों ऑप्शन में नहीं आएगा, either lamotrigine or levetiracetam. Then आते बात पे, levetiracetam also can be used in patient with head injury and stroke to prevent seizure. ठीक है? To prevent the seizure. Okay. Then next question. What is that? If a patient comes to you with absent seizures are seen only in the children. Absent seizure. If the child is, what is the age you are going to look? Age देखना चाहिए. Age. What is the age you are going to look? 2 year, 3 year, 4 year, 5 year, 10 year, 15 year. What you are going to look? Absent seizure में what you are going to look? You are going to use two drugs. Ethosuximide, which is a calcium channel blocker. Okay, so this age you are going to look less than 4 years. More than 4 years, valproate. More than 4 years, valproate. Okay, let's continue. Valproate can cause side effect. Valproate can also cause side effects. That's pancreatitis. It can lead to pancreatitis. Side effects of valproate. It will increase the risk of PCOD. Okay, it can also lead to weight gain. So these are the important things. Okay, so these are the things which you need to know. Next important, if a female is having a next condition, eclampsia, then you are going to use MGS. MGSO4 का antidote कौन है? Antidote and monitor. What you need to monitor? Antidote will be your calcium gluconate. Okay, then monitoring will be your what you monitor? Yes, the treatment you are going to give with the help of Picard regime. Monitoring, what you need to do is knee-jerk reflex. What is that? Knee-jerk reflex. Okay, this is the story of your CN. CN is the important aspect. Okay, so once we are done with it, let's get into the next important aspect. What is that? Your CVS. So CVS पे चलते हैं. When we are going into the CVS, the most important drugs are antihypertensive. Antihypertensive drugs. In the antihypertensive drugs, very good tendon reflex, especially which tendon you are going to. Yeah, you are right, tendon reflex, but using which one? Using a knee jerk reflex. Okay, you are right with the tendon reflex monitored with the help of knee jerk reflex monitoring. Okay. Now listen to me. Antihypertensive drugs. Antihypertensive drugs. I want you to understand one of the most important drugs. They're your beta blockers. They're your beta blockers. Beta blockers, they are going to block the beta 1 receptor. Because of the beta 1 receptor, so neonatal seizure के अंदर भाई देखना चाहिए किस चीज की वजह से आ रहा है. Neonates के अंदर seizures are caused by numerous things. We need to look. If it is caused by hypocalcemia, then we need to do the electrolyte correction, like calcium correction. If it is caused by fever, then the treatment will become rectal diazepam. Then we are going to give them a fever treatment, that is your sponge bath, and there will be what you are going to do, that will be a paracetamol. Like that you are going to manage. Okay, do not get confused. Beta 1 blocking will lead to decrease of the renin. This point will become a very important MCQ. I told you people in the starting of the lecture, renin will be released. See, in the kidney, beta 1 receptors are present. If I stimulate beta 1 receptor, renin will be released. If I block beta 1 receptor, renin will not be released. So, ध्यान से देखो, decrease the renin release. Decrease the renin release. Decrease the renin release. If they decrease the renin release, I want you to understand. यहाँ पे ध्यान से सुनना. Which antihypertensive drugs decrease the release or decrease the production of renin? They are going to be your beta blockers. They are going to be your beta blockers. They are going to be your beta blockers. समझ में आ गया? Decrease renin production or release, that will lead to decrease of the BP. That will lead to decrease of the BP. So I'm not going to waste your time by telling the beta blockers name, which you already know. That is why ना मैं इससे बोल रहा था. यहाँ पे एक box. Aliskirin, confused मत हो. Primaskirin. These drugs inhibit renin, which is already released. Okay, so please understand, अगर renin already blood में आ गया, उसको बंद करेगा तुम्हारा एलिस्केरिन एंड प्रिमास्केरिन. अरे तुम ऐसा कंफ्यूज हो गए ये करके ही तो मैं इतना ध्यान से बोला ना. सो दैट इज द सोल पर्पस, बिकॉज मोस्ट ऑफ अस विल गेट कंफ्यूज्ड इन दिस पॉइंट और एग्जाम के दिन याद नहीं आएगा. तो टू अवॉइड दैट मिस्टेक, एलिस्केरिन प्रिमास्केरिन डिक्रीज द रेनिन व्हिच इज ऑलरेडी रिलीज्ड, व्हिच विल गो बाइंड विद द रेनिन जो ऑलरेडी रिलीज हो गया. Okay, that is your aliskirin and primaskirin. And beta 1 blocking will not allow the renin to come into the blood itself. That is why we are going to call it as renin release inhibitor. They are your beta blocker. If renin is already released, then we are going to use aliskirin primaskirin to inhibit that. Okay, clear everybody? Any doubts? Everybody clear with this concept? So these are your beta blockers. I'm not going to waste your time in further with these things. Okay, I want you to understand the next group of drugs. We have something called as ACE inhibitors. Thank you. Let's continue. ACE inhibitor. My dear students, we have something called as angiotensin 1, which will get converted into angiotensin 2. Okay, which will be done with the help of ACE. ठीक है, सिर्फ पिक्चर याद रखना, आपको एंजियोटेंसिन कन्वर्टिंग एंजाइम्स एंड आर्ब्स पूरा हो जाए. दिस विल गो एंड एक्ट ऑन द angiotensin 2 receptors. ठीक है, angiotensin 2 काम करता है एक रेसेप्टर पे, दैट इज योर angiotensin 2 receptor. Okay, अब there is one more substance, that is your bradykinin. Now bradykinin will break down into its breakdown products. Okay, ACE inhibitor are going to inhibit the ACE. So now listen to me. Angiotensin 2 used to cause the vasoconstriction and increase the BP. Now ACE is inhibited. If ACE is inhibited, there is no conversion. If there is no conversion, AC inhibitor will lead to decrease of angiotensin 2, decrease of angiotensin 2. At the same time, they will decrease, they will not cause, there is no further vasodilation, vasoconstriction, no vasoconstriction, that will lead to decrease of the BP. Key, the reason is angiotensin 2 receptor stimulation used to cause vasoconstriction and increase the BP. Now inhibition will lead to decrease of the, there is no angiotensin 2, no stimulation, there is no BP. At the same time, angiotensin 2 will be decreased. Okay. Now at the same time, one more will increase of something called as bradykinin. कौन है? Bradykinin बढ़ जाएगा, जिसके वजह से एक साइड इफेक्ट आता है ड्राई कफ. लीड टू ए साइड इफेक्ट कॉल्ड एज ड्राई कफ. It will lead to a side effect called as dry cough. Okay, angio ACE inhibitor. Now I want you to understand one side effect we understood, that is dry cough. Along with that, my dear students, please understand they will also cause, I will also cause angioedema. Most of you might have this angioedema caused by ACE inhibitor, but in which patient? In patient with C1 esterase deficiency. C1 esterase कहाँ पे? C1 esterase deficiency. C1 esterase deficiency is seen. C1 enzyme कहाँ पे आता है? C1 esterase is the enzyme of which pathway? Okay, let's continue to the next step. AC inhibitor का uses. They are used in hypertension with diabetes mellitus. Because the reason is they decrease the proteinuria. मतलब proteinuria को कम करवाते हैं. Any patient with a loss of protein will have a proteinuria. The proteinuria will be prevented by AC inhibitors. That is why hypertension with diabetes patient, we are going to use AC inhibitor, because diabetes patient is at high risk of progressing into diabetic nephropathy. Okay, that is why. Okay, now they are also used in congestive heart failure. Because they will decrease the load on the heart. They'll decrease the load on the heart. So if they're decreasing the load on the heart, they prevent cardiac remodeling. अगर कोई भी drug, if it is decreasing the load on the heart, they're preventing cardiac remodeling. Okay, then let's go to the drugs. They are your pills. All the pills, captopril, enalapril, lisinopril, all these things. Okay, but I want you to understand enalapril. Enalapril is a type of prodrug. Its active metabolite. Is, what is the active metabolite of enalapril? Enalprilat. What is that? Enalprilat. Okay, hope you understood. Let's continue to the next group of drugs. ARBs are going to do what? Let's go back here. यहाँ पे मैं एक बात बता रहा था. पीछे देखो यहाँ पे. तुम्हारा पीछे नहीं, यहाँ पे. मतलब previously. That's what I meant. ठीक है. चलो. So angiotensin 2 receptors will cause, their stimulation used to cause vasoconstriction. है ना? Stimulation करने की वजह से vasoconstriction. So if there is a vasoconstriction, we need to prevent that. Means ARBs are angiotensin receptor blockers. If they are blocking the angiotensin receptor, there will be vasodilation that will lead to decrease of the BP. Again, they are used in hypertension, MI, but MI में always नहीं होता है, not always, based on the requirement. They are also used in the congestive heart failure, because they also decrease the load on the heart. The drugs are your sartans. What is that? Sartan, such as losartan, telmisartan, valsartan, and all this. Okay, but a patient having a gout with hypertension, which is the best drug, best antihypertensive drug, I want you to remember the drug is your losartan. Losartan shown to be effective for a patient is having gout with hypertension. So yaad rakho sartan. So repeat with me. Gout with hypertension, losartan. Gout with hypertension, losartan. Gout with hypertension, losartan. Hypertension with diabetes. AC inhibitor. There are pills. Okay. Then BPH with hypertension. Best preferred ones are, yes, there you are alpha blockers, like that. Okay, see, losartan, valsartan we can use for diabetic nephropathy. They are not first line. These inhibitors prevent a proteinuria. They are the first line for diabetic nephropathy. Please don't get confused. Let's go to the next important drugs. We are done with three groups of drugs. Let's go to the next important anti-hypertensive drugs. Diuretics. Now listen to me very carefully. Diuretics best use are thiazides. Thiazides, abhi, I'll just tell you one line. Later I'll tell you people a lot. Okay, thiazides are drugs. Thiazides are the drugs. These are the drug of choice for hypertension. Drug of choice for hypertension. ओके, इधर डोंट गिव यू एनीथिंग, कुछ भी नहीं दिया है, वो कुछ भी नहीं दिया. ड्रग ऑफ चॉइस फॉर हाइपरटेंशन करो, थायराइड डायबिटिक्स. Then let's go to the next important, calcium channel blockers. Calcium channel blockers, I want you to understand calcium channel blockers. So यहाँ पे थोड़ा टाइम दे दूंगा मैं. Calcium channels are two types, L type, T type. So L type are located in the smooth muscles. स्मूथ मसल में कौन सा काम पे, स्मूथ मसल में काम पे होता है दया रिवर. स्मूथ मसल में काम पे होता है, दैट इज योर वेरी गुड, दैट इज योर ब्लड वेसल, इंटेस्टाइन और हर जगह. सो दिस कैल्शियम चैनल ब्लॉकर, if calcium channel blockers mechanism of action is that they inhibit L type calcium channels. They inhibit L type calcium channels. So because of L type calcium channel inhibition, they lead to smooth muscle relaxation. Why smooth muscle relaxation? Listen to me. In physiology, you have studied muscle contraction requires. Muscle contraction requires, what is that? Hunching. That requires calcium. So if calcium is not there, muscles will relax. Muscles will relax. As PDF will be available. Okay, smooth muscle relaxation, smooth muscle relaxation. So that will lead to decrease of the BP, that will lead to decrease of the BP. So mechanism of action of calcium channel blocker, we are looking at T type or L type. We are looking only and only at, yes my dear students, we are looking at a L type calcium channel blocker. The drugs are dihydropyridines. In these dihydropyridines, you have some important drugs which you need to understand from the dihydropyridines is that some dihydropyridines important drugs are what are those dihydropyridines, such as nicardipine, okay, and we have amlodipine, okay, we have one more drug. What is that? Amlodipine. We have one more drug, that is nifedipine. ये सारे काम पे काम करता है. They all work in only and only in the smooth muscle. So nicardipine, all these drugs, my dear students, they will cause some side effect. Dihydropyridines, the side effects will be such as reflex tachycardia. Okay, remember reflex tachycardia. Apart from that reflex tachycardia, yes, there will be one more effect. What is that one more effect? This will lead to constipation. Will also lead to constipation. So what are the uses बहुत सारे हैं इनके dihydropyridines के. one of them your hypertension. Agreed. Hypertension के अलावा पे यूज होते हैं. They are used in achalasia cardia, in anal fissures, in the anal fissures में लोकल क्रीम्स की तरह में यूज करते हो लोकल एनल फीचर्स के अंदर भी, ताकि स्मूथ मसल का टोन कम हो जाए, so that patient will be able to defecate. All these things are parts of your, what is that, uses of the dihydropyridines. T type calcium channel blockers. See, T type calcium channel blocker. So T type calcium channels are located in the heart. So if we block T-type calcium channels, if T-type are blocked, they will decrease the heart rate. Okay, they will decrease the heart rate. And T-type calcium channel block करने की वजह से there will be direct effect on the SA node. SA node के ऊपर block हो जाता है, जिसके वजह से there will be decrease of the heart rate. That is why they are used as anti-arrhythmics. I want you to understand one of the most important anti-arrhythmics. They are your calcium channel blockers of which class? Class 4. I'm not going to repeat this later on, so that we will save our. Hope everybody is clear so far. समझ में आ रहा है कि नहीं आ रहा है? जल्दी से बताओ. I'll continue further. So once you understood about the hypertension, I want you people to remember some of the important points. Important points. What are the important points which you need to remember about the hypertension? Look here, यहाँ से मैं 100% गारंटी से बोल सकता हूँ. ठीक है जी. So there are some most important ones. Listen to me. Anti-HTN drug cause gout. The answer देखो cause gout. What is the answer? Then next important. I'm going to mention only the points which are already not mentioned. Okay. Then tell me an anti-hypertensive drug. Anti-hypertensive drug which is used in BPH plus hypertension, which was also already told. Okay. Then they will also ask you hydrolysing. About hydrolysing, you need to know about lebicolol. You need to know about alpha methyl dope. All these three drugs. Okay, chalo batao फटाफट से. First one at least you people should answer. Antihypertensive which cause the gout. Focus here. The antihypertensive drugs which cause the gout are thiazides. The antihypertensive which cause the gout are thiazides. BPH with hypertension, they are your alpha blockers. Okay. Tamsulosin selective acting drug. Alpha 1A acting drug. Hydrolysine labetalol methyl dopa. These are the drugs safe in pregnancy. Best is this. ठीक है जी. अरे hypertension with BPH, you're telling only tamsulosin for BPH symptom relief, right? देख लिया मैंने कमेंट सबका. ठीक है, चेंज मत किया करो. कोई बात नहीं, it's okay. Make all the mistakes here. Okay, ताकि you don't make the mistakes in the exam. Right? Now let's continue to the next important. What is that? Next important concept, my dear students, see antihypertensive drugs. In the antihypertensive drugs, which is the drug of choice for insulin? Okay, antihypertensive, which is the drug, which is antihypertensive, which I already told me. Okay, so drug of choice for insulin, that is your diazoxide. What is that? Diazoxide. All these are very important points which should be remembered. Okay, apart from that, hypertension with these things, what is that? Hypertension with the I explained you hypertension with diabetes and other things also I explained you people. Okay, now all this is the story, but there are some other points. There are some two more points. Hypertensive emergency. What is hypertensive emergency? Hypertension emergency. इसका अगर कोई गलत बोलोगे तब मतलब बताओ, व्हाट इज हाइपरटेंसिव इमरजेंसी एंड हाइपरटेंसिव अर्जेंसी, माय डियर स्टूडेंट्स? हाँ जी, बता दिए. Hypertensive emergency is a condition, there is an increase of the BP with the end organ damage. सबको रट के याद है कि end organ damage करके, but what are the end organ damages they will give in that question? That is your stroke, that is your hemorrhagic stroke or ischemic stroke. ठीक है, उसके साथ में MI या aortic dissection, any of these aortic dissection. आई के अंदर भी एक सिम्टम होता है, आई के अंदर retinal detachment, retinal hemorrhage. All these are hypertensive emergency का conditions. ठीक है, बीपी बढ़ा हुआ होगा, बीपी बढ़ा हुआ के साथ साथ एंड ऑर्गन डैमेज सच एज पेशेंट को हेमोरेजिक स्ट्रोक आया हो, बीपी हो, इन दोस थिंग्स. हाइपरटेंसिव इमरजेंसी के लिए बेस्ट ड्रग इज एस्मोला. ठीक है, एस्मोलॉल इज बेटर। अर्लियर टाइम पे हम लोग यूज करते थे सोडियम नाइट्रोक्साइड, ठीक है, सुन लो मेरा बात, अर्लियर टाइम। आज के टाइम पे बेस्ट अपडेट क्या बोलता है, एस्मोलॉल। एस्मोलॉल इज ए बीटा ड्रग, बीटा एंटागोनिस्ट which is a fastest acting drug and shortest and fastest acting drug. Hypertensive urgency, there is only increase of BP, no organ damage, no organ damage, ठीक है। In that condition, yes, you can use this calcium channel. Sir, why can't we use thiazides? Thiazides are used for the long-term management, but they are not used for the emergencies and urgencies, ठीक है। लेबिटलॉल इन प्रेग्नेंट फीमेल ड्रग, लेबिटलॉल से भी बेहतर ड्रग है एक्चुअली, अकॉर्डिंग टू द लेटेस्ट अपडेट्स बेटर ड्रग is esmolol, but the thing is that clinical practice में due to the availability we change the user, we might change the different drug। समझ में आ गया? then next important concept, भाई एस्मोलॉल मार्क किया करो, देन सोडियम नाइट्रोक्साइड, लेबिटलॉल सब ऑप्शन में कंसीडर, ठीक है। होप एवरीबडी इज क्लियर, वेरी नाइस। लेट्स कंटिन्यू टू व्हाट नेक्स्ट इंपॉर्टेंट, व्हाट इज दैट नेक्स्ट इंपॉर्टेंट, प्रेगनेंसी का तो डन हो गया, प्रेगनेंसी का तो डन, इंसुलिन हो गया, ऑल दिस आर डन। apart from this, so there is one last point, that is intracranial hypertension। Intracranial hypertension is different from intracranial pressure increased. These are two different conditions, okay। हाँ, nicardipine option is there, that's what I'm going to come to। intracranial hypertension के लिए, हाँ भाई क्रेनियम बोल दे तो स्ट्रोक आ गया तो बस निकार्डिपिन डाल दे ना, हाइपरटेंसिव इमरजेंसी अलग, इंट्राक्रेनियल हाइपरटेंशन, ठीक है जी, वेरी गुड, दैट इज योर निकार्डिपिन। यहां पे आता है इंट्राक्रेनियल हाइपरटेंशन, आईसीपी बढ़ गया हुआ तो यार इतना बात को अगर कुछ भी नहीं कर पाते हो, आई गिव यू बेस्ट आइडिया, इसको मैं मिनिमाइज करता हूँ यहाँ पे। चलो फटाफट से एक स्क्रीनशॉट उठा के रखो, और ये कहाँ पे भी देखना चाहिए पता है, सुबह उठ के ना यहाँ तक क्रॉप कर लेना, पहले से ही डिस्क्लेमर, इसको क्रॉप कर लेना। जब टॉयलेट जाओगे वहां पे भी इंस्टाग्राम देखने से बेहतर, रादर देन लुकिंग एट इंस्टाग्राम, इन द बाथरूम आल्सो यू कैन लुक एट दिस एंड रिमेंबर दिस पॉइंट्स इन 5 मिनट्स, ओके। इसलिए मैं बोला क्रॉप कर। एंड इतने में आपको एक से दो क्वेश्चन आएगा, 148 to 150 का डिफरेंस बनाता है एक स्क्रीनशॉट, सोचो, क्रॉप कर लेना जरूर अगर वॉशरूम में पढ़ रहे हो तो, ठीक है। लेट्स कंटिन्यू, ओके, होप यू पीपल अंडरस्टूड, okay। So this is a story which I wanted people to understand from the what is that, from the hypertension। Let's continue, next important, congestive heart failure। In the congestive heart failure, drugs prevent remodeling, when we are preventing the remodeling, the drugs which prevent the remodeling are beta blockers, diuretics, ठीक है। देन वी हैव ड्रग्स सच एज, नेक्स्ट इंपॉर्टेंट ड्रग्स कौन सी है, दे आर योर एसी इनहिबिटर्स, देन यू हैव ARBs। all these drugs prevent the remodeling because all these drugs decrease the load on the heart, okay। next, beta blocker, one important, they increase the filling also, क्योंकि बीटा ब्लॉकर बाय डिक्रीज द हार्ट, जिसके वजह से increase the duration of diastole, because of which there is a better filling। there will be sometimes, there will be few second of नेट का प्रॉब्लम हुआ हो सकता है, पॉसिबल। अगर ऐसा कुछ हो रहा है तो थोड़ा आगे पीछे ऐसा, मतलब 10 सेकंड आप बैकवर्ड फॉरवर्ड करके देख लेना, आ जाएगा, ठीक है। क्योंकि आई एम कंटिन्यूसली, देखो यहाँ पे मैं देखता रहता हूँ, I'll keep looking here, so that I'll be reading your comments, so that is why I'll be able to understand what is going on. Okay, so if that is going on, please check once. Let's continue. Next important, there is some drug that is there is some drug which increase the contractility of the heart. What is the drug which increase the contractility of the heart? The drug which increase the contractility of the heart is digoxin. So digoxin, most important mechanism of action. There are two mechanisms. One of them inhibits sodium potassium ATPase. Sodium potassium ATPase, that's it. Or sodium potassium ATPase inhibitor के बाद से there will be increase of sodium, it will be exchanged with calcium, that will increase the contraction. Another mechanism of action is that it will increase the vagus activity. It will increase the vagus activity. Since it will increase the vagus activity, decrease the heart rate, जिसके वजह से भी increase the feeling. ये दोनों mechanism. Okay, digibind, this is what. पढ़ लो ध्यान से, digibind. Yes, it will be available till the exam also. It will be there in the channel. Okay, listen, digibind will be not in the options. Okay, now let's continue to the next important. डिजॉक्सिन की वजह से there will be some toxicity. डिजॉक्सिन की वजह से toxicity हो सकता है. डिजॉक्सिन toxicity will lead to complaints such as bradycardia. Okay, bradycardia के अलावा it will lead to muscle weakness. Apart from the muscle weakness, bradycardia and muscle weakness, the patient will also have yellow halos, vomiting and diarrhea. So all these things, bradycardia, weakness, yellow halos and vomiting. Okay, digibind का antidote. Digibind is not the antidote. Not the antidote. सुन लो, ठीक है, सुन लो. Digibind will not be in the option because it is not the antidote. Antidote for this overdose. This was asked in NEET PG recently, thinking that everybody will buy head digibind. And you know, नहीं है आंसर इसके लिए. The answer is antidote is digoxin. immune ठीक है, ये है इसका पूरा नाम, इसको बोलते हो डिजिबाइंड. सो एग्जैक्टली एग्जामिनर this he will give. This was asked very recently, very recently, बहुत recently पूछा गया था. Very recently it was asked. That is why it is very important. Digoxin immune antibody. Clear everybody? Clear. ठीक है. So with this much being said, antidote for digoxin immune antibody is done. Okay, bradycardia, weakness, yellow halos, etc. We are done. Important concept of CVS. Okay, but we are getting into one more important thing which I'm going to tell you people right now. Which I'm going to tell you people is that क्या है? ये देखो, ये सिंपल सी बात है. तो डिगॉक्सिन तो समझ में आ गया ना. एंटी एरिथमिक्स माय डियर स्टूडेंट्स, आई एम नॉट गोइंग टू डू इट इन द रिवीजन, क्योंकि आप लोग इतने मेहनत करके कुछ ना कुछ ट्रिक बना के याद रखे, उसको मैं छेड़ूंगा नहीं, फिर आप लोग भूल जाओगे, मुझे गाली दोगे. So rather than that, I'll tell you people techniques, anti-arrhythmics. If a patient is having ventricular, best treatment, and drug of choice. Both ventricular arrhythmia में both VTAC and VTAC both are included. ठीक है. ECG कैसा दिखता है? VTAC का ECG दिखता है ऐसा, मोनोमॉर्फिक QRS कॉम्प्लेक्स, मतलब एक ही शेप का, सेम शेप, इतना याद रखो, सेम शेप QRS. अगर सेम शेप QRS मिल गया, दैट्स इट, यू आर डन विद इट, द डायग्नोसिस इज बीटेक। वेंट्रिकुलर फिब्रिलेशन, कुछ भी डिजाइन बनाओ, ये सारा वेंट्रिकुलर फिब्रिलेशन। नाउ बेस्ट ट्रीटमेंट विल बी डीसी शॉक, डीसी शॉक, ठीक है। देन ड्रग ऑफ चॉइस विल बी लोकल। Okay, so basically cardioversion, electric cardioversion, DC shock is a electric cardioversion, electric, and this second is a chemical. Now apart from that, next important thing, atrial flutter, atrial flutter usually does not require treatment, does not require treatment. Then atrial fibrillation, for atrial fibrillation the treatment is beta blockers, equally effective as calcium channel blockers, equally effective as calcium channel blockers. Which type of calcium channel blockers? They are your diltiazem, diltiazem or vera, ठीक है। नेक्स्ट इंपॉर्टेंट थिंग, अगर कोई पेशेंट को PSVT आता है, सर PSVT को कैसा पहचाने? पेशेंट विल हैव कंप्लेंट्स ऑफ palpitation, palpitation, increase heart rate, okay, on ECG, on ECG। आपको इतना याद रखो, आपको इतना याद रखो, आपको इतना याद रखो, सुपर इम्पोज्ड, आपको समझा देता हूँ मैं, सुपर इम्पोज्ड P and T वेव। आपको ऐसा बोलूंगा तो आपको समझ में नहीं आएगा, तो आई टेल यू वेरी इजी वे। सो यू कैन नॉट डिफरेंशिएट T वेव वर्सेस P वेव, which is P, which is T, you cannot differentiate, which is P, which is T, you cannot differentiate. Again and again I told you people, so ECG would look something like this. So which is P, which is T, you cannot differentiate. P की RST होनी चाहिए ना, कौन सी P है कौन सी T है आपको समझ में नहीं आएगा। अब ये इसमें भी पता नहीं सकते हो। अगर इसको मैं P बोलूंगा तो फिर ये कौन है, ये T है कि P, क्योंकि फॉलोड बाय दैट QRS। सो ये दोनों एक दूसरे के ऊपर मर्ज हो जाएगा। उस टाइम पे ड्रग ऑफ चॉइस इज एडिनोसिन, ठीक है। अदर थिंग्स विच कैन बी डन हियर, ध्यान से सुनो, अदर थिंग्स विच कैन बी डन हियर, other things are your carotid massage, ठीक है। कैरोटिड मसाज के अलावा वाल्साल्वा कर सकते हो, वाल्साल्वा कर सकते हैं, ठीक है। इसके अलावा ये दोनों क्या करते हैं, ये दोनों के वजह से दैट विल लीड टू वेगस एक्टिवेशन, वेगस एक्टिवेट हो जाएगा। वेगस अगर एक्टिवेशन हो जाएगा तो ऑटोमेटिकली इट विल लीड टू डिक्रीज ऑफ द हार्ट। That is why, so all the things which can be done here is the written, okay। yes the question आ सकते हैं, all of the following are used in PSVT, ये भी question is possible, ठीक है। so this is the story of your arrhythmia related question oriented। Then there is one thing in antiarrhythmic which causes hypo or hyperthyroidism, that is your amiodarone, because it is a derivative of iodine। ये आयोडीन का डेरिवेटिव होता है जिसके वजह से हाइपो और हाइपरथायरॉइडिज्म कॉज करवा सकता है, वो है तुम्हारा अमियोड्रोन, ओके। नाउ दिस अमियोड्रोन कैन लीड टू पेरिफेरल न्यूरोपैथी, ओके। देन इट कैन लीड टू पल्मोनरी फाइब्रोसिस आल्सो। क्या हो गया Jatin, what happened? And Imran, sir, for SVT is a misnomer for PSVT, ठीक है। That's it. Anybody, किसी को ये अरिथमिया टॉपिक सर से ऊपर चला गया, एनीबडी फॉर whom it has taken up? अगर किसी को लगता है सर we are not able to follow this thing, so आप लोगों को कुछ मत करना, सेम वीडियो को इसके बाद ये टाइमिंग याद रखना कितने बजे हुआ है, उसका अप्रोक्सीमेट करके आई रिक्वेस्ट यू टू गो बैक एंड लुक एट दिस वीडियो ऑफ 5 to 10 minutes, you will be able to understand everything, ठीक है, सिंपल। अगर फिर भी काम नहीं आता है तो जल्दी बता देता हूँ। इन अरिथमिया, वेंट्रिकुलर अरिथमिया में बेस्ट ड्रग होता है लिडोकेन, बेस्ट ट्रीटमेंट होता है डीसी शॉक। वेंट्रिकुलर अरिथमिया मोस्ट कॉमनली हमारा एग्जाम के लिए दो होते हैं, टू आते हैं, वी टैक, वी फीवर। वेंट्रिकुलर टैकिकार्डिया में ऑल द QRS कॉम्प्लेक्स लुक सेम, सो सारे QRS कॉम्प्लेक्स एक ही तरह दिखता है। V-Fib में कुछ भी ऐसा मतलब you will not be able to differentiate QRS complex. That is what is called as ventricular fibrillation. In V-Fib, best treatment DC shock, electrical shock नहीं होता है, लीड हो गए दो, ठीक है। अगर एट्रियल फ्लटर आता है यूजुअली ट्रीटमेंट का जरूरत नहीं पड़ता है। एट्रियल फिब्रिलेशन में बीटा ब्लॉकर is equal effective that of calcium channel blocker. calcium channel blocker हमारे पास है DLTS और वेराप। अगर आपको AFib के ECG के बारे में पूछते हो तो the patient will have different RR interval and most importantly no P wave। मतलब आपको P wave नहीं दिखेगा। P wave नहीं दिखने के साथ साथ एक आरवेव से दूसरा आरवेव के बीच में द डिस्टेंस यूजुअली रिमेन सेम, बट इसमें क्या होता है कंटिन्यूसली चेंज होता है, ठीक है। वो हो गया ये पीएसवीटी का पेशेंट आता है palpitations लेके, हार्ट रेट बढ़ा हुआ रहता है, तब ईसीजी करोगे जिसके अंदर आपको ईसीजी में कौन सी वेव होता है PQRST। बट यहाँ पे ECG देखोगे, इन दिस ECG इफ यू नोटिस यू कैन नॉट डिफरेंशिएट बिटवीन P वेव कहाँ पे है, T वेव कहाँ पे है। So if you cannot differentiate between the P wave and the T wave, okay, that time we are going to consider it as a what is that PSVT, okay. Then drug of choice, what is that drug of choice will be adenosine. Other manipulations which can be done is carotid massage and Valsalva. So I'm clear now, Valsalva करने से vagus nerve activate होता है जिसकी वजह से heart rate will be decreased, ठीक है। ओके, देयर वाज अ फ्यू सेकंड्स ट्रक हो गया था, फिर अभी ठीक हो गया होगा। होप एवरीबॉडी अंडरस्टूड। So these are the major topics which I wanted to do for you people. These are the major topics. Along with that, yes, you will get the PDF. You will get it solved. I will give you people one important, इसमें से I can assure you, ठीक है, इतना। Now important points PDF will be given, जिसको आपको क्या करना होगा on the day of exam, morning I want you to go through. The day of exam morning I want you to go through once. This is important point का PDF। For all these things you communicate with the AFMG team, okay। So once you communicate with the team, they'll give you because I'll be forwarding it to the team, so you can get it from the AFMG group, okay। Then next important thing, now I want you to remember, listen to me. One of the most important thing I told you people, sleep, food and all those I told you people. Right now, last 7 days, what to do? Last 7 days, first 3 days we are going to divide. First 3 days, okay. Last 7 days what you need to do. Then last 4 days, what to do, what not to do. In first 3 days, look at paper 2 subjects. Okay, paper 2 subjects such as clinical subjects such as surgery, OB, okay, then medicine, then if you are doing then other subjects, those things you need to pay attention. Okay. In the last 4 days, paper 1. In paper 1, see, order should be that this paper 1 subject should be revised. Then next important part pe aata hu. In this, sir, all subjects should be revised are only important topics, only highlights which you have made on the notes, okay. In that, most important time to be given to the surgery and OPG, all right. Then इसका जो हाइलाइट्स के साथ इमेजेस होंगे, वो इमेजेस कहाँ पे ज्यादा फोकस करें। इमेजेस, सी आई विल टेल यू पीपल, सर्जरी विथ रेडियो images will be very useful for you people, okay। Then Ortho images are very important and focus on derma images. Okay, see others, okay, I agree, others also important, but major focus to be paid here सर्जरी विथ रेडियो, आर्थो एंड डर्मा, ये तीनों के इमेजेस के ऊपर ज्यादा ध्यान रखा. सो बेयरली इट विल टेक, ये आर्थो और डर्मा पिक्चर करने के लिए 1 to 2 hours लगेगा. ठीक है, बचा हुआ सर्जरी रेडियो इमेजेस देखो, फिर ये नोट्स को रिवाइज करो. दैट्स द प्लान यू नीड टू फर्स्ट. देन लेट्स गो टू द पेपर. पेपर 1 का 4 days है. सो 4 days है. सो इन दिस 4 days वी हैव 4 days to exam, 3 days to exam, 3 days to exam, we have 3 days to exam, right? Then we have 2 days, then we have last. So how to use your time on this? So 4 days to exam जब होता है, यहाँ पे रिवाइज करो, यहाँ पे रिवाइज करो अपना पैथ, अपना FSM, अपना FSM with PSM. ठीक है जी. देन 3 days to go, 3 days to go, वहां पे रिवाइज करो माइक्रो जी. along with that, along with micro, I will tell you people, biochem, biochem, along with the biochem, फिर से ले चलो PSM, then also take PSM. Okay, last 2 days to exam. Physio, important only physio, important concepts. Okay, along with that, anat, physio, patho, biochem, and here pharma. Okay, अगर last day पे आते हैं, then any left out confusion, confusing topics in the morning, okay, in the afternoon, yes, in the afternoon PSM, along with the PSM, any other left out things and all should be done in the morning itself. Any other things that will be your biochem one-liners, biochem important one-liners for half an hour, 30 minutes you need to do. Then you need to do pharmac one-liners, again for 30 minutes. ठीक है जी. Then along with the pharmac one-liners, आप लोगों को advisable is that I can advise you for one more thing. along with, देखो afternoon already तुम 2 बजे से लेके 6 बजे तक करोगे, फिर around 7 o'clock you people will be again ready, तो 30 minutes कर लो, 1 hour, 8 बज जाएगा. Then you are done. By 7 to 8 it is over. Yes, I'll come to the dejoxing part, 1 second. Okay, then on the morning, so please get sleep, and you'll pass it. Get sleep. After all this done, get sleep, go to exam, then your result will be flying colors passing. What is a flying color के साथ passing? This is the strategy. ऐसा बनाते strategy, बोलते हैं ना बहुत लोग. Anybody want to take a screenshot? Take last 7 days what to be done. Okay, hope everybody is clear. समझ में आया क्या करना है आखिर 6 दिन में जी? Everybody understood what to be done in the last 7 days. This is how you need to do. Okay, everybody understood? 8 बजे तक खत्म करो. नींद मेरा बात सुनो. एग्जाम का पिछले दिन कंप्लीट सफिशिएंट नींद ले लो, नहीं तो आप लोग पेपर 2 के टाइम पे you'll have lunch, आफ्टर लंच, ड्यूरिंग पेपर 2. अरे पेपर से ज्यादा तुम्हें नींद लगेगा. प्लीज अंडरस्टैंड. ओके, प्लीज अंडरस्टैंड दिस. होप एवरीबody understood. And somebody told me they want to take a digoxin screenshot. Take screenshot of the digoxin here. Okay, So this is how we need to do. This is how something called a strategy. Okay, so for everybody who asked, sir हमारे लिए क्लास कब होगा, तुम्हारे लिए आ गया क्लास. ठीक है. So for all of you, what you need to do, please communicate with the टीम एंड आप लोग ग्रुप में ऐड हो जाओ एक्सेट्रा इन ऑल दोस थिंग्स. आप लोगों को ये इसका अनोटेटेड नोट्स मिलेगा. सो प्लीज कम्युनिकेट टू आवर टीम फॉर एवरी क्वेरी एंड डिटेल्स, दे विल हेल्प यू आउट. ठीक है, समझ गए? अंडरस्टूड? होप दिस सेशन वाज यूजफुल. समझ में आने लगता है. If you have any queries, you can contact me. If you have any queries, you can contact me. Okay. Yes. And if you want me to take, like, if you want further classes also, you can contact to the team and we'll be doing the classes. Don't worry. And if you have any queries, you can contact me. Just a second. Let me check that. If I'm right or wrong. Yes, this is my number. So on this you can contact me if you need some help. Okay, if you're panicked or something like that, we can help you. Okay, PDF कब तक मिलेगा? या आफ्टर 1 to 2 hours के बाद टीम को कांटेक्ट कीजिएगा जी, मिल जाएगा. ठीक है. All right, everybody happy with the class today? Did you like the class? Do you feel confident about all the systems and topics which I did? Yes, बताओ. मिल जाएगा PDF मिल जाएगा. Okay, perfect. So I want everyone to achieve the great success. Wish you a very all the best, and we'll be again in touch. Okay, again in touch, and we'll help you out with anything you need. Okay, so if you need anything, you can contact. Okay, so just stick to the schedule. Don't change anything into the new information. क्योंकि इंसान का ना एक आदत होता है, एक गंदा आदत होता है. ये गंदा आदत is that अगर कोई एक बंदा, if one person says, oh my god, it is so that this and all, you leave what you worked hard for and you'll just get into what some random people's information. Do not do that. Okay, next thing, do not get scared. Yeah, you went to abroad, you did so many things, you came back, you are able to deal with it. Okay, see, if you get scared, you tend to forget. Rather than that, for once you think, I studied for this much time, I can pass the exam. And one more thing, wherever you are making the mistakes, please note, okay, यहाँ पे मेरा गलती हो रहा है, मुझे सुधारना. एक बार खुद को ये बोल लो, I made a mistake here, I need to prevent it from happening. You tell that to yourself once, then you will not make that mistake. Got the point? Point number 2. The next important thing is that please focus on your sleep cycle. Sleep cycle is very important. Please eat some good energetic food. Then third thing is that यार एग्जामिनर ना एक बात समझो आपका, ये आप लोग एफएमजी का कैलकुलेशन ही गलत समझ के बैठे हो. व्हाट इज दैट? यू पीपल विल थिंक, ओ माय गॉड, आई नीड टू गेट 50%, आई नीड टू गेट 150 marks to pass. Yeah, think like this. Examiner is telling to make 150 mistakes, still I'll pass you. एग्जामिनर बोल रहे कि भाई तू 150 गलत कर 300 में से, फिर भी मैं तुझे पास करूंगा. बढ़िया. माय नेम इज डॉक्टर मारुति. ठीक है. सो लिसन प्लीज, एग्जामिनर बोल रहे कि भाई तू गलत कर, मेक द मिस्टेक, हाउ मच 150, फिर भी मैं तुझे पास करूंगा. और क्या टेंशन ले रहे हो यार? इट इज लाइक एवरी सेकेंड क्वेश्चन इफ यू मेक मिस्टेक you are passed. Every second question if you make mistake also you are passed. है कि नहीं? अगर हम लोग यार 60 क्वेश्चन दोनों पेपर में कर लेंगे शॉर्ट, और बचा हुआ गेस वर्क भी करेंगे, आधा गेस वर्क भी सही हो जाएगा, 160 पार हो जाएगा. ये भी तो सोचा करो. ठीक है. सो कीप योर माइंड काम. और कभी कोई बोला कि यार मुझे टेंशन हो रहा है, ये हो रहा है, मेरा एक बात है, Maruti sir told one thing, that you can make 150 mistakes and still you can pass. ठीक है, remember this. And repetition of the things is the key to success during this type of exams. ठीक है, तो please focus on that. And अभी तुम लोगों को इधर क्या हो रहा है, उधर क्या हो रहा है, एनबी ने वो बोल दिया, इधर वाले ने वो बोल दिया, ये बोल दिया, वो बोल दिया, सब छोड़ो यार. तुम्हें एग्जाम का डेट दिया हुआ, हाल टिकट आने वाला है, जाओगे, लिखोगे, तुम पास होगे. ठीक है, इतना कॉन्फिडेंस रख के जाना है खुद के ऊपर, हमेशा फुल कॉन्फिडेंस, स्वैग में जाना है, स्वैग में बाहर आओगे. क्योंकि मोस्ट ऑफ द पीपल जो फेल होते हैं, वन ऑफ द मेजर रीजन मैं नोटिस किया हूँ, दैट मेजर रीजन इज दैट दे डोंट हैव कॉन्फिडेंस ऑन देमसेल्फ एंड देयर ओन प्रिपरेशन. दैट विल पुल देम बैक. डोंट डू दैट. ठीक है, खुद के ऊपर थोड़ा सा करूंगा मैं, हो जाएगा, कर लिया मैंने, I did, yes, I have put all my effort, yes, I can pass, yes, I have confidence. This much you put in the brain, then you study, बहुत अच्छे से चीज, things will remain in your brain. At the same time you'll have a good sleep health. Okay, if anybody has a habit of sleeping late, waking up late in the morning, now stop that habit, try to change it. It will be a difficult 2 to 3 days, in third day it will be fine. All right, doctor, with this much I'll finish my session, I'll take a leave, and you can watch any other videos on the YouTube as well. For your this thing in the channel, they are available. At the same time, I want you to study really well, and wish you all the best. Good luck.